the last 2 years. With all, many families and businesses have been impacted by the pandemic and recently by the Marshall Fire. We know you all are very busy and you have many things on your plate right now, I think so, but we know that you care, that's why you are here. So we cannot thank you enough for volunteering your time and participating with us in guiding the process to build together an equitable recovery for Boulder County. As you know, these meetings are always hard, so we have a tight agenda. So we don't have time to introduce all of us, but please place your name and your organization on the chat. And you also can change your name and add your organization by clicking on the 3 dots on your picture. So then you can do it. So now let me give you a little background. Boulder County started this process by inviting nonprofits in the community that have and represent diverse networks and audience to form a steering committee to guide them on how to spend ARPA funding. These partners have co-designed and have really driven this process, and we have ensured that the voices of the community are at the table. The steering committee now will introduce themselves, and now let's start with Charlotte. Charlotte, can you please open your mic? Looks like Charlotte is not here yet, but let me continue with. She's here. Okay, go ahead.
Had trouble unmuting there. So my name is Charlotte Lasasso. I'm the Executive Director of Boulder County Arts Alliance. We're the county's only multidiscipline arts service agency. Happy to be here.
Thank you, Charlotte. Now let's have Mary Lee.
Good morning. My name is Mary Lee Geary. I'm a dean at Front Range Community College's Boulder County campus. I've been with the college for 15 years, and I'm happy to give my input and serve in this manner. Thank you.
Thank you. Let's have now Rebecca.
Good morning, everybody. I'm Rebecca Navinger. I'm the Executive Director and CEO of Imagine, and I am here representing Human Services Alliance on the working committee. Thank you.
Thank you. Now let's have John Taylor. It looks like my colleague John Taylor is not here, but he has also been supporting this group. Now let's have Chris. Katrina from the same group, are you here?
Katrina Harms, and I'm not sure where Chris is. Hopefully she's somewhere there, from the Peak to Peak Housing and Human Service Alliance and the Netherland Food Pantry in Western Boulder County.
Thank you. Now let's have Amy.
Hi, everybody. I'm Amy from Rebuild by Design, and I'm here with my colleague.
Hi, everyone. Johanna Lawton from Rebuild by Design. Thanks for coming. Great to meet you all.
Thank you. And lastly, I would like to invite Tatiana Fernandez to provide some few words. Thank you, Tatiana.
Gracias, Bere, and warm welcome to our working group members. I am Tatiana Hernandez, here with the Community Foundation Boulder County. Today is an exciting moment for our community. This pandemic exposed some of the starkest inequalities in our community. And throughout the pandemic, the Community Foundation has worked closely with our nonprofit and government partners to ensure support was available to those who needed it most. Through our COVID-19 fund, the foundation has distributed over $1.9 million to meet our community's needs so far. Of course, that is nothing compared to the amount that is available via federal Arpa recovery funds, which present an opportunity to address the social inequalities for those who have disproportionately suffered due to race, ethnicity, ability, income, age, and gender. It is our hope, it is the foundation's hope, that the ARPA steering committee and working group process not only creates transformational change for our community, but creates transformational change in how our government collaborates with its residents, businesses, students, and experts like you. The foundation has been working closely with Boulder County on supporting this process, and we want to recognize Commissioners Loachman, Levy, and Jones for creating a truly collaborative process for allocating our recovery funds to the people who need it most. Working together, last summer we engaged the organization Rebuild by Design to lead us through this process, and they are here with us today. I now turn this over to Amy Chester and Rebuild by Design. Thank you.
Thank you so much, Tatiana. And we're actually joined here today by two commissioners, Marta Lochiman and Claire Levy. I want to give you both a chance to say hi before we jump right in.
And I believe Commissioner Jones is here as well.
Oh, excellent. So let's do that in that order. Commissioner Lochiman, would you like to go first?
Buenos dias and good morning, everybody. Just a quick moment of appreciation to all of you. This project really is a labor of love and input and commitment from each of the steering committee folks who've been meeting weekly for almost a year. The commitment from the folks that you just heard from, and certainly Community Foundation Boulder County. So just to know that we are now officially moving into phase 2, despite the other challenges that our community is facing. I just welcome each of you today. And we are here to build solutions. We are here to be innovative. We're here to jump out of the box and also stay within our federal guidelines, which we'll get to hear about. So I just want to say thank you again and appreciate all the time from not only the steering committee folks, but also the working groups and everybody else that's been in your circle and your networks that have been part of this process from the very beginning. Thank you.
And I will welcome you all as well. And I hope I have a lot of opportunities through this process to thank each of you for the time that you are lending to Boulder County and to the people of Boulder County, really, to help us invest what is now about between $50 and $53 million of federal funds in a way that will make the biggest difference to the people of Boulder County. What brought you all here today, what motivated us to create this, this inclusive, community-driven process is the knowledge that the effects of the pandemic fell disproportionately on people in Boulder County who had less financial means. It fell disproportionately on people of color. And the fact that it did that was a reflection of the inequities in our economy and in the ability to access services and have access to healthcare. And so this is our opportunity to try to address a portion of that inequity. It's not going to solve the problem. $53 million isn't enough. But at least we can start thinking about how we can change some of the most important things in Boulder County that create a foundation for health equity and address those social determinants of health, which had such a strong effect on who got sick and who did not, who had access to health care and who did not, who was able to get to a vaccine clinic and who could not, who had to work and who could isolate. All of those things led to the disparities that we're trying to address. And I thank each of you for the time you're going to put into this, for coming to the table in a constructive way. And I'm so excited to see what we're going to do at the end of this process.
Thank you so much. And Commissioner Jones?
Yes, I'll chime in. Thanks so much for being part of this. It's such important work. It is hard to believe it's been 2 years now that we have worked through this challenge that we have internationally, nationally, state level, and the county. And it's had a real impact on real people. And that's what's so important about this work. And I could not think of any other time where the federal government, perhaps in the downturn a couple, 2 decades ago, that put that kind of money forward, but not that the county could have a strong say in where it goes. And so this is a real opportunity for us. It's one-time, so-called one-time money. It goes on for 4 years. But there have been a lot of impacts to people in Boulder County, and this is a chance for us to analyze those and address those impacts and try to come out even better on the other side of this. You know, I've talked about my cancer. When you get knocked down, you get up, then you try to come back stronger. I had survived 2 cancers. And I think this is the same thing. I think we really need to think about how we help people, and it has been inequitable impact. People with higher incomes are doing just fine. People with lower incomes have taken the brunt of this. So this is a real opportunity for us, and I'm just appreciative of all of you willing to give your time so we make a real informed decision up front on what this is. It's taken us a little longer, and I want to appreciate Marta for all the work she put into this from the beginning. But it's just so important to get right. So thanks for helping us do that, and looking forward to working with you. I'm going to be doing the mental health and social resilience group. So thanks again.
Thank you, commissioners. I am Amy Chester from Rebuild by Design. And we are the organization that was brought in by Boulder County with the support of the Community Foundation of Boulder County to help guide this process. We have a packed agenda for you today. Our morning will begin with the foundational knowledge that you need to support your group's work, such as understanding the federal Arpa requirements, the information we have already heard during our public engagement process this fall, and how our response can center equity, and an overview of the community members who have been most affected by the pandemic. Looking ahead, each working group, in the afternoon, we have speakers from the city of Boulder and Longmont to share how they'll be allocating their funding, and from the Urban Institute, who will provide examples of the types of investments that are making transformative change nationwide. We'll then give a chance for each of the working groups to meet, to dig in, and to start their work. Looking ahead, each working group will meet twice more before the final recommendations are developed. Each working group is co-led by a community expert and a Boulder County agency leader. They'll be leading you through the process. Rebuild by Design and the county's engagement team are here to support that work. A few logistics to go over for today, and I have a list of them, so please bear with me. We've all been very used to Zoom for quite a while now. As Commissioner Jones said, 2 years, it's quite amazing. So just a short reminder to make sure that you are muted in a big meeting like this. The next is that we're going to do our best to keep on time. We have a timekeeper, and Aisa from the county's engagement staff is going to help with that. Aisa can raise her hand. We have set up ample Q&A time at the end of the morning and then at the end of the afternoon session. So if you have a question that can be handled later on, please write it down and let us know afterwards. But if it's something burning, of course, you can do it at the time. The chat function in Zoom is open. However, remind you to hold your concentration in the main room with the speaker as much as possible. Chats can be distracting in a large meeting. Sophia from the county's engagement team will be monitoring our chat and can help you with any questions and logistics. We plan to have a few short breaks and then an early lunch at 11:30. In adherence to transparency and inclusivity practices, all of our sessions will be recorded and posted on the Boulder County website, just as other Boulder County meetings are. And the slides will be made available for you to reference. If you have friends or colleagues who'd like to know more about this process, please send them to the ARPA website at the county's website for more information, and that's where the videos will be posted. For today, you should have 3 calendar invites, and we'll go over this again later on. But you should have 3 calendar invites. One is for this main room. The second is for your breakout room, which you'll be joining around 2 p.m. this afternoon. And the third is when we come back together in the other room. We're using these different links to make sure that we can record the simultaneous conversation. Lastly, if you have any technical issues, please use the chat function to contact Joanna Lawton. Joanna, please raise your hand. Thank you, and Joanna will work you through any logistics. So let's kick it off. The ARPA Steering Committee has been meeting now for quite a few months since the summer, and it had many conversations about how this funding could be used to be the most transformational. So here are goals that were set by the steering committee and the commissioners, and we hope that this entire process can help us reach the goals. The first one is to be transformational. This is probably the most important one. We want to make sure that we are really making change for the people who have been impacted the most during the pandemic. The second is that it strikes a balance between long-term transformational change and short-term immediate relief We know our community members are still in crisis mode and they need our help. The third is that it could be deployed easily to make sure that we're helping folks quickly. We want to ensure that our programs are sustainable, so when ARPA funding runs out, we're not leaving a huge hole for the county to try and fill. That our programs and ideas focus on equity and addressing the racial, economic, and health disparities. That it leverages already completed plans and research that has been going on through our community, and that it's groundbreaking, something that the government wouldn't have done on their own. I'm now going to turn it over to Leslie, who's going to talk to you about the U.S. Treasury guidelines for ARPA. Thank you, Leslie.
Good morning, everyone. My name is Leslie Irwin. I work in the Boulder County Commissioner's Office, and I am the ARPA administrator, overseeing all the aspects of ARPA, and some of my team members are on the call. And I think Johanna is going, or Amy is going to show my slides. So there you are, that's who I am, and I'm going to talk about Treasury guidance. That's what we always look to decide if something's eligible and how to design a program. We look at the Treasury final rule that came out in January and programmatic or reporting and compliance guidance from last summer. So next slide. And we were allocated a little more than 63 million. You heard Commissioner Levy mention 53 million, and that's because we've already allocated about 5.6 million out into the community for immediate needs, and some in our organization as well, and in public health. These dates are important because we can pay for expenses from March 3rd. So in some cases, we could pay for expenses that have already occurred March 3rd, 2021. All funds have to be obligated. That means in a contract or a purchase order issued by December 31st, 2024, and then projects completed by December 31st, 2026. Next slide. And this is how Treasury talks about the allowable uses in the final rule. There's this very large public health and economic response category. So that's for attending to public health mitigation, response, recovery, and then the negative economic impacts. And a lot of your relevant eligible categories are in that ginormous category. There's also a premium pay for essential workers category, and I know ideas around that have been proposed. And I'm slowing down for the interpreters, and I apologize. I even have a sticky note here that says slowly, and I haven't been doing that. There's also a very large category called water, sewer, and broadband infrastructure with parameters around that. And I'm including that here because some housing affordability projects could include water and sewer infrastructure. And we've heard about the need for broadband, especially in areas that don't have good broadband. Next slide, please. And then that ginormous category there, public health and economic impacts, is broken out into these subcategories. Behavioral health, so that's the mental health and social resilience group, assistance to individuals and households, small businesses, nonprofits. I bolded those because those are most relevant for you today. Next slide. And then I do want to talk about a couple of overarching things with ARPA, and that is equity, which you've heard many people mention already today. These funds really are designed to address disparate impacts and to build equity in our community. This language is directly from Treasury guidance. So these are things that we have to report to Treasury, both with the overall pot of funds and within projects and programs. So how are we, and Treasury, there are many aspects of eligibility or equity, I apologize. And Treasury talks about economic and racial equity and how we prioritize that as a goal and how we will produce meaningful equity results at scale. And strategies. So strategies would be like, are we targeting historically underserved, marginalized populations? How are we making people aware of our programs? What if they don't have laptops or devices? Are we making our programs accessible? Are we having, if we have something in person required, are we providing childcare? So, and then outcomes, how are we closing gaps with our desired outcomes of the projects, programs, and services we fund with ARPA? So equity is overarching over the entire pot of funds and within programs. Next slide. And then just another sort of cross working group constraint I just wanted you to know about is that most assistance to households and individuals has income constraints. So you couldn't say, let's give every resident in Boulder County X, Y, or Z, unless it's broadband, because broadband isn't constrained in that same way. But cash assistance, food assistance, etc. are constrained. I will say though, mental health and substance use services are not constrained, and public health is not constrained, like response and mitigation. And the income there is just there for your information. So some project areas are constrained to low to moderate income. Some are constrained to low income. You don't need to worry about that. You just need to know that there are income constraints. All right, I think we're about to, next slide, dive into the specific working groups. This is economic challenges. And what I'm going to do here is tell you everything that's eligible in this category. And this is the biggest or broadest one. So next slide. So in this category, you'll find individual and household assistance, such as food assistance, rent, mortgage, utility, cash assistance, child care assistance and facilities, and internet access. I do want to let folks know that Boulder County has $22 million of emergency rental assistance, including utilities. So we should be thinking of that pot before ARPA for rent assistance. Next slide. There's a large or a broad job seeking, job training category that has a range of things, including like providing childcare and transportation to and from a job site or interview, incentives for workers, subsidized employment, grants to hire, assistance to help unemployed individuals start small businesses. So it's a broad category as well. Next slide. And then here is aid to businesses. So again, this one is constrained because we can't say we're just going to help all businesses in Boulder County. We have to be able to demonstrate that they've had, as a result of the pandemic, decreased revenue, financial insecurity, or increased costs, such as having to, renovate facilities or change facilities. Or we would have to demonstrate capacity to weather financial hardship, and other challenges. And then the assistance available is rather broad, loaner grants to mitigate those challenges. There's some things listed that they could pay for, or technical assistance, counseling, and other services. Next slide. And this is aid to nonprofits, very similar to the prior one. I just wanted to point out one of the on increased costs, it'll show uncompensated increases in services needs. So a lot of our nonprofits have had demand for increased services, but not necessarily money to hire or to fund those services. So otherwise very similar to the business assistance category. Next slide. All right, premium pay, and we have heard this recommended from folks, so I just wanted to provide you with the parameters here. It's for people who were necessary to maintain operations, so it's in-person work only. And Treasury enumerates a lot. Here are a handful of sectors. Treasury enumerates a number more in their guidance, but really it's the face-to-face, in-person, had to keep going to work. There are some income constraints. It's that they can't be earning more than 150% the state average for that occupation. So some constraints there. Next slide. All right, so that one was the broadest category. Now we'll go to housing affordability, which is a little more straightforward, but still somewhat broad. So here you have development, preservation, and acquisition of, so the whole continuum there of affordable housing. I put rent, mortgage, utility here as well, because this group could also talk about that. Delinquent property taxes, Treasury calls that out. Counseling and legal aid, services for people who are unhoused, permanently supportive housing. So that's where you have housing and then you have case management on site or other services is supporting them on site. And land banking would be in that category where you're purchasing land to build affordable housing. Next slide. And then again, I wanted to call out the water and wastewater infrastructure because we have heard a couple of projects floating out there in the county of, for example, mobile home communities with improved either drinking water, wastewater, so or both. And so I just wanted you to know the water and wastewater infrastructure is relevant to the housing affordability category. All right, next slide. And here is mental health and social resilience. And next slide. Which Treasury talks about either as behavioral health and mental health and substance use. So in the bigger description of the category, it's behavioral health. So here again, really quite broad. So prevention, treatment, diversion programs, outreach, harm reduction, recovery support, work in schools with youth, pregnant women, work with pregnant women or infants born with neonatal abstinence syndrome, peer support groups, recovery housing, hotline services, and then opioid use disorder prevention, treatment, harm reduction, and recovery. So quite a broad category there. And then there's another slide of it, I think, next slide. And Treasury also calls out these things as to how to support equitable access to reduce disparities in access to high quality treatment, and then behavioral health facilities and equipment, and community violence intervention programs. Next slide, there you go. And so in this category as well is social isolation, and broadband and ability to connect is one way that that can be addressed. And so in this category, which is relevant to this working group, would be programs, devices, equipment for internet access and digital literacy, including subsidies for costs, although there are other federal funds for that. So we would look to that first before ARPA, and then broadband infrastructure investments. And Treasury goes quite into the weeds on connection speed and different things about that. That's very technical, that I know we have resources that could talk to that working group if you were exploring broadband, but pretty broad as well. Okay, next slide. All right, that's it. Those are my slides. So I think what I heard Amy say was hold questions to the end of the morning, but I don't know if we have time. I think
you have 2 minutes if you want to use it
all
however
right.
way you like.
All right, are there any questions? I know that was a lot of information. Focus on, what's eligible in your bucket there. And just to let you know, I'll be coming to the different working groups. So if questions come up when you're on, when you're in your working group, save those and I'll come answer those in each working group. Suicide prevention, yes, Kathy. Absolutely, yes, you could get a copy of the PowerPoint, Mika.
Yes. So Joanna will let everybody know how to access these slides later this afternoon.
Excellent. All right, thank you so much, everyone. And I will be around today and in the future if questions ever come up.
Great, thank you so much, Leslie. Summer, you're up next.
Great, thanks, Amy. I think we can go ahead and go to the next slide then. Yeah, good morning, everybody. It's great to be here with you as you embark on this journey to help determine how the federal pandemic relief funding here that Boulder County has received can best and most equitably address the impacts of the pandemic on our community. My name is Summer Laws, and I'm a policy analyst in the Commissioner's Office. And I have a background in public health and health equity, and I currently support the county's policy goals in behavioral health, community health, economic issues and employment, human services, community justice, equity, alongside other members of the policy team. Next slide, please. So as you've heard throughout this morning, again, I want to emphasize that it's important to center our conversation on equity and racial equity. This quote from the CDC points out, and as many of us have observed and even lived, the pandemic had a disparate impact here in our community and across the globe. People who are working on the front lines and didn't have the option to work from home, people with existing chronic conditions, and people with lower incomes were harder hit by COVID-19 and the economic fallout of the pandemic. And because racism is evident in our systems and policies in the United States, people of color were more likely to be working on the front lines, more likely to have these existing conditions, or more likely to have a lower income, and thus were even more disparately impacted. Next slide. So what's this section of the presentation going to cover? I've been asked to provide a summary of the impacts of the pandemic for each of the working group areas. As we all know, the pandemic impacts have been comprehensive, affecting almost every aspect of each of these areas and more. So this morning, we'll just walk through a few pieces of data available in each area, but please know that this is not an exhaustive presentation and that more information and data is available, and that your own experience and your own work to assess the impacts of the pandemic are equally as important. So following this presentation, you'll hear from Johanna Lawton of Rebuild by Design about what our community has identified as pandemic impacts. So that won't be covered during this presentation. And next slide, please. So this is an older, I realize now since I submitted these slides last week, this is an older slide, but just to kick it off, I wanted to share some information about COVID-19, the community. We do see decreasing case rates, though we're still at an elevated rate as of last week's data and high transmission by the CDC's indicators. But just last week, the CDC created a new metric for community level COVID-19 impacts that includes new admissions to the hospital and per 100,000, the amount of staffed inpatient beds, and the number of new cases per 100,000 people. So we'll start to see a different metric moving forward. And as we all know, we're very grateful that the Omicron variant has proved to be less severe and that we're seeing case numbers declining. We still hear that hospitals are stressed and that we're still reporting deaths in our community. And so just want to keep this front and center that disease is still here in our community. Next slide, please. I'll just quickly mention a couple other statistics that are great news that we have. Over 300,000 people in Boulder County have at least a partial course of vaccination, and that's about 93%. And so we're tracking well in terms of coverage of vaccination. A lot of that has to do with some of the health equity efforts within our public health department through partnerships with some of the organizations here on the call. So thank you for that. Next slide. So connected to the quote that you saw earlier from the CDC in this presentation, this is a graphic from the Kaiser Family Foundation that really demonstrates how people of color have been disparately impacted by the disease. That people of Black, Latino, and American Indian racial and ethnic background are almost 3 times at risk for hospitalization and twice at risk for death than people of white and Asian backgrounds across the United States. And just as we go through this presentation, it's really important to remember that racial and ethnic disparities are created by long-standing inequities and systemic racism, not individual behaviors. And that they're not due to genetic differences, but rather these centuries-long economic policies and discrimination that have impacted people's access to healthcare, wealth, mental health, social resilience, access to housing, and other factors. Next slide, please. So this is the results from the Colorado Health Institute's 2021 Colorado Health Access Survey, which they conduct every 2 years. It's a survey of Coloradans from across the state on important health access issues. I just include this data to remind us of the issues of discrimination that still affect so many people in our state, related to many factors like income, ethnic background, race, disability, age, experience with violence or abuse, gender identity, and sexual orientation. This was a question around how people felt, whether or not they felt respected or if they were treated with less respect by their healthcare provider. And though this is just a specific statistic on within the healthcare setting, it is important that any intervention that your working groups design must ensure equitable access and treatment for all community members of all backgrounds and experiences. Next slide. So we'll jump into what is the mental health and social resilience working group. Here I have it labeled as behavioral health. Next slide. This is also data from the Colorado Health Institute's Colorado Health Access Survey. And you can see that there's been an increase in Coloradans that are reporting poor mental health in that top section of the slide. More than 1 in 3 Coloradans ages 16 and up said their mental health was negatively affected by the pandemic, including more than half of young adults. Additionally, I wanted to note that Mental Health America, an organization that advocates for improved mental health and mental health healthcare access nationwide, found Colorado to be very last in the nation in terms of the number of adults who are impacted by negative mental health and the state's very challenging access to mental health services. And then additionally, at the bottom of the slide, you could see how it points out the interconnectedness of mental health and economic challenges, that approximately 60% of people with unstable housing or access to food reported 8 or more poor mental health days in the last month, as compared to people who reported stable housing and access to food. And then additionally, that what's not on the slide, I did want to share some data from Boulder County, which conducted several surveys during the pandemic. Their most recent survey of almost 300 respondents noted that mental health of those respondents themselves or their loved ones, that mental health was the primary concern during the pandemic for almost 92% of the respondents. So just how important this is for so many people. Next slide. This is some data from that has to do with emergency department visits. It's comparing year after year. So that purple line that you see is 2019 data. The green line that you see is 2020, and the red line that you see is 2021. And this is very tragic data just in terms of the impact of the pandemic on the mental health of our young people in Boulder County. That we saw such an increase of suicide attempts amongst young people during the pandemic. And then though most schools are now meeting in person and youth are less isolated, many mental health providers are still reporting very full caseloads and backlogs in both the public and private provider settings in terms of serving youth. Colorado Children's Hospital has also seen a 90% increase in demand for behavioral health treatment, and they've declared a youth mental health state of emergency. Next slide. Similarly, we saw what some folks called the second pandemic in terms of the impact on substance use during this time. And I know many of you are well aware of this and well aware of the disparities. And according to the American Medical Association, the nation's COVID pandemic made the nation's drug overdose epidemic much worse. Every state, including Colorado, has reported an increase of overdose deaths and other problems driven by illicit fentanyl, fentanyl analogs, methamphetamine, cocaine, and often in combination. Over here locally, our own harm reduction and syringe access program saw an increase in the number of syringes going out in the peak of the pandemic compared to the previous year, and has been seeing a slight decrease in numbers of clients participating in the program though. Next slide. So this is quite a jump to go from the mental health and substance use impacts to broadband statistics, but within that same working group for social resilience, you will be looking at broadband access. And I'm just sharing this slide as a note that there's much more robust data available about broadband access. This was created by a consultant for Boulder County, and there's some sharing of indicators around how a digital divide index is calculated. So just so you know that you'll have access to all that data, but I won't dive into that during this time. Next slide. Oops, I'm sorry, I just lost my access to my notes. It'll be just a second here. Here we go. So for this working group that's addressing economic challenges, you will have a variety of tools at your disposal, as Leslie's mentioned in the previous presentation. We'll just take a really quick look at data that speaks about how the pandemic has impacted individuals' economic situation, but do note that there's been severe also impact on businesses and small businesses, and that you received a report from TDA Consulting that includes more data and information about what particular sectors were most impacted, so that you have access to that for more information. And next slide. So this is again a slide that demonstrates disparity in terms of the impact of the pandemic on people by income. So that lower blue line represents people earning under $27,000 per year. The middle green line represents people earning between $27,000 and $60,000 a year, and the upper red line is people making more than $60,000 a year. This is from a website called Track the Recovery, and though it notes the impact on employment, and this is as of August of last year, but overall we've seen that those that earn higher incomes have traditionally or have been doing better throughout the pandemic versus those at middle and low incomes. And here, this is information from the U.S. Census Bureau. I'm sorry, this is information from the Colorado Health Access Survey that really just shows about how the impact how the pandemic impacted different communities of color across the state of Colorado. This is self-reported data in terms of people reporting struggling to pay for necessities by race and by ethnicity. And you can see there's a great disparity across demographic groups. Also, the U.S. Census Bureau has reported that the economic impact was not felt equally, and that the Joint Center for Housing Studies of Harvard University says, quote, people of color, particularly Latinx people, were more likely to be working in low-wage jobs, most vulnerable to furloughs and layoffs, especially in hard-hit industries such as leisure and hospitality, retail, and construction, which we know are still struggling at this time. And next slide. Additionally, as you know, the childcare sector was already struggling even prior to the pandemic. But this is data from the 2021 Colorado Health Access Survey that shows that childcare is a serious concern for almost 1/2 of Coloradans. And then this question around what is the reason why folks can't access childcare, really pointing to either affordability or being closed during the pandemic. Additionally, here in Colorado, even in 2019, the Bipartisan Economic Policy Institute reported that the cost of childcare across the 50 states in Washington, D.C., a report that in Colorado, our average cost of childcare was $15,325 a year, and that's the 8th highest in the U.S. among the 50 states in Washington, D.C. Next slide. So similar to childcare, the high cost of housing has been a challenge in Boulder County for many years. Even in 2017, more than half of renters in Boulder County spent more than 1/3 of their income on housing costs, according to census data, compared to 46% of renters nationally. Additionally, the median cost of a single family home more than doubled from 2003 to 2019 in Louisville, Lafayette, and Superior. So I think here we go. And I'm going to start off with some information from the Colorado Health Foundation, and then I'll describe what you're seeing here in terms of rental assistance, which Leslie alluded to. But the pulse survey from the Colorado Health Foundation found that housing is still a major concern among Coloradans across the state, and that the pandemic has increased financial pressures for renters and homeowners. That 44% of households with incomes under $50,000 are worried about losing their own home because they're unable to pay their rent or mortgage. But Boulder County has continued to invest and manage programs to address needs in rent, mortgage, and utility support. And so the Boulder County Department of Housing and Human Services has tracked total rent and utility dollars distributed to community members in need, which includes existing and COVID-related assistance, distributing more than $8.5 million in rental and utility assistance since March 2020 to September 2021. So just a note that financial assistance has been in our community and that we continue to manage that program. And next slide. Oh, let's see. Oh, oops. So additionally, the issue of homelessness is a complex issue. I wanted to just share some data from the Metro Denver Homeless Initiative, which conducts an annual count and survey of people experiencing homelessness. The 2021 annual point in time count, which captured shelter data only this year due to COVID-19 showed an increase of individuals staying in shelters on a single night and showed a drastic increase in those experiencing homelessness for the first time. So this is across the 7-county metro region, which saw an increase of 40% for people staying in emergency shelters on a single night for a total of 4,072. And this graphic is from a 2020 Homeless Solutions for Boulder County survey report. Homeless Solutions for Boulder County is an innovative approach to homelessness that includes multiple government entities, which are here on this call, such as Boulder County, cities of Boulder, Longmont, and many nonprofits working together to impact homelessness. And so this is just some data that shows that a large portion of people experiencing homelessness in Boulder County report a disabling condition that prevents them from remaining stably housed. Next slide. And then in closing, I just wanted to mention that there is also funding that the state has received, almost $4 billion in total of Arpa funding. They have the same eligibility categories as we do as a local government, and that they're planning to distribute approximately almost $2 billion this year. And that some of that is being determined through what the General Assembly or the legislature's 2021 transformational task forces. So within the behavioral health category, they're going to be expending about $450 million. And there is a category within there that would be local and nonprofit grants. Similarly, within the housing category, there's $400 million available, and there will also be some grants for local governments and nonprofits. I just wanted to mention that, and that's it. Thank you so much.
Does anybody have any quick questions? We actually are doing great. We have 3 minutes until our break. Anybody has 1 or 2 questions? If not, you can also ask them right before lunch. Okay. So let's go on break and let's meet back at the top of the hour for Joanna Lawton's presentation on what we've already heard from our fellow community members in Boulder County. See you then.
Okay, so hi everyone, I'm Johanna Lawton again from Rebuild by Design, the organization that was brought in at the start of this process to help co-design and facilitate a community engagement process to hear how the community was impacted by the pandemic. And a lot of the information I'm going to talk about will be familiar to many of you. A lot of this is written up in our Arpa Steering Committee Preliminary Engagement Report, which is in your welcome packet. It can also be found on the county's website. It will also be in the Google Drive. So if you'd like to read more details about some of the topics I'm going to be talking about, I encourage you to read through that report. Also, this process, my talk will sound a little bit familiar because many of you actually played a role in it in different ways. So at the start of this process back over the summer, Boulder County enlisted us to help co-design a community engagement process to help mitigate the impacts of future challenges on those who were most impacted by the pandemic through this large-scale community engagement effort. And our goals were to be transformative and inclusive and equitable, much of the same goals that we share for this second process, but also to create like robust opportunities for people to engage and provide feedback. And we were very fortunate, as you were able to meet everyone earlier, to have fantastic partners and the support of the Community Foundation throughout this process. So we had a very, very tight timeline for this. As some of you may recall, it seemed to fly by. Back in August, we were able to identify these partners to begin this process. And we co-designed it together, meeting weekly, and then we created materials and translated those. We designed outreach and engagement events, and then it very quickly brought all that information together into a final report that was presented to BOCC. And again, if you want to see that final presentation, that's also in your welcome packets. And we can show you where in the Google Drive you can find those as well. And at the start of this process, we decided to highlight some of those target communities that were really impacted by the pandemic. And as you heard from Summer's presentation, we had all this fantastic data to see who those communities were, but also the lived experience of our partners, to see who were they seeing and hearing from on a regular basis that were really struggling during this time. And this is not an exhaustive list by any means. This just helped us start to put some faces to the groups that we should conduct extra outreach to. And then we also co-identified some best practices for community engagement, and many of those carry over into this process as well. But again, this is not an exhaustive list, and it's always a dynamic list that we're adding to of some of the best practices we would hold ourselves accountable to throughout the entire process. And then we started right away creating some materials. At the start of this process, we knew that we were going to have to adjust to the rise of the Delta variant and the potential for a shutdown right at the beginning. So we made everything accessible online and complemented it with in-person events. But we made sure we had it translated into Spanish and Nepalese, and distributed it as widely as we could through the networks through our partners. And we set some high goals. We thought 6 weeks, let's try and get 1,500 surveys, 30 events. It was a whirlwind. We had tons of materials going out. Aisa Garita, who you are going to meet soon, as well as Ignacio Barunda, who's not with the county right now, but they were boots on the ground every day out there talking to community members, distributing flyers, postcards, and it was a fantastic whirlwind to hear everyone's ideas. Excuse me. And we were very excited to see that we did meet our goals. We had over 1,500 surveys, 41 engagement events, reached out to over 330 organizations. Some of them, I'm sure, are your organizations who participated in this effort, to hear everybody's feedback. And when we looked at the final results, here we go. Okay. So when we collected our final results, we were also keeping track of the demographics of who we were reaching with our outreach. The participants were predominantly white, but we did have a decent participation from the Latino, Latina, Hispanic, Spanish community at 14%, which was largely, we think, due to having bilingual cultural brokers throughout the process. We also had 11% of participants identify as having a disability or accessibility needs. 28% of participants indicated they were frontline workers. Our respondents were primarily female and were heterosexual. Geography-wise, we had a pretty wide distribution of responses, although they were mostly centered in some of the cities, but we did find we did get 19% of the responses from West Boulder County, which again, I'm going to attribute to the amazing women from Peak to Peak who were coming up with all sorts of creative ways to talk to people. So then for the actual survey questions, we left it largely open-ended to make sure that we weren't putting any words in the into anyone's head before they had a chance to think of some ideas for themselves. So all of our questions were open-ended, and what we did with those responses was categorize them under the ARPA guideline buckets that you saw earlier in Leslie's presentation, so that we could start to see some general trends among the responses. And we found that largely across every demographic that we could break it down by, people were struggling or found the biggest challenges of living in Boulder County to be negative economic impacts, affordable housing, the cost of living, public health, childcare. And then when we asked about the same question, but during the pandemic, we found similar responses, just all those issues were magnified. A ton of the responses included things like getting priced out of the county due to the rising housing costs, pandemic-related job losses, or not being able to hire workforces, overcrowding in homes. And we'll go into some more of the responses later on. We also looked at where people were receiving support during the pandemic. And interestingly, we found that primarily our respondents said they relied on family and loved ones, and then friends and neighbors, their jobs throughout the pandemic. But then when we looked specifically at the respondents who filled out the Spanish language survey, we found that those respondents primarily relied on local nonprofits and organizations. And then finally, our fifth question was, what single action can Boulder County take to benefit you, your family, or your business? And again, these are just the broad categories. We found that most respondents said, gave us ideas relating to affordable housing, economic support, and then public health, and within that bucket, it was primarily mental health. And so we saw that as a clear direction for phase 2, that we should look into the overlapping issues of housing affordability and economic challenges, as well as mental health and the need to support social resilience. And then 2 other just interesting themes that came up a ton were a distrust or more of a doubt that many respondents had that their ideas would matter and that their opinions would have a role in this process. And then we also found that many were unsure of the resources that were already available to them through the county. So those are just 2 things to keep in mind as you continue in this process. And so I'm going to hand it over to Aisa, who is going to talk more about what those ideas actually sounded like, given that those were just the kind of the broad categories. I don't know how we are on time if people have specific questions about that. But again, those slides will be made available to you all.
We're doing pretty good on time, so let's turn it over to Aisha and then we can take a few questions likely.
Great.
Can I start now? Yes. Okay. Welcome everyone. My name is Aisa Garita from the Community Engagement team in the Commissioner's Office. Happy to be here. We can move to the next one. As Joanna mentioned before, in the previous slides, community members have the opportunity to submit their input in various ways. Me and my partner for the community engagement in phase 1 walk around with the surveys to get input from many members of the community, as well as attending events and creating them, as well as community conversations to get feedback. We got from the BOCC town hall, as well as some ideas that community members had for the funds. We created a Arpa input email for community members to send their ideas, as well as nonprofits send us as well reports about how they think we should be using the funds. We can move to the next one. When we look closer at the responses, we found a couple of important themes emerge among the challenges in the community that they were facing, and some of them are still. Some of those were attracting a workforce. It was a big challenge for nonprofits, businesses, school, mental health services. It was a big impact economically for them to keep their staff. And social isolation remained a big challenge for many in the community, as well as the mental health and the technological divide. They were part of this. The mountain community have a big social isolation and resources, so we saw a big challenge there. When we jump into nonprofit organizations, that they were at the front line for helping members of the community during the pandemic. Last year, they were in need of resources to help, mostly in the Hispanic community, to help navigate assistance for programs. We know that nonprofits
Sorry.
It's okay. We know that nonprofits are an industry that was have a big impact, particularly affected by the labor crisis. Without a healthy workforce, they were challenged by give their resources to the community. We can jump into the next one. While issues like housing affordability were frequent across all demographics, we also saw some common themes emerge among the responses that were more unique and specific to some communities around Boulder County. Some of those were bringing technology access to the mountain communities, as well as some neighborhoods in Boulder County central area where they don't have access to internet, as well as creating social programs for those in isolation due to health, physical, or cognitive ability, as well as support to small businesses and nonprofit organizations who cannot expand their workforce during this time, and provide services for those who have struggled with mental health and hiring mental health, the workforce in the mental health. We can jump into the next one. There is a big wide range in the answers that were provided, such as creating more affordable housing units while limiting the purchases of investment from rental properties, as well as requirements for businesses that were added, more support for available complying, as well as building social infrastructure through community events that also support local businesses, and creating that space for community members to engage. Support social events to increase mental health in the community. I know this was a big impact during the pandemic due to not being able to be with members of the community due to COVID. Creating a navigation system to connect community members to services they need. We saw this as a big issue. Some of members of the community, especially the Latinx community, didn't have knowledge of what resources they have available from the county, if it wasn't from the nonprofits that we heard before by Joanna, that mostly other communities relying on nonprofits. Promote alternative sources for transportation, such as multipurpose paths connecting to shopping, eating, and living, as well as support professionals who can help address mental illnesses. This was a big topic in the survey and emails we received about the mental health crisis that Colorado is facing right now. So this was a big issue suggested that we found out in the survey. And we know that none of all the feedback we receive is eligible under the U.S. Treasury Arpa guidelines. To make sure that and make it easy for you, Leslie, review all the ideas that we have collected in one document, and they were checked for the eligibility. This document, you receive it on Friday, and it will be used in the working groups later today. So if you have any questions, please let us know. We can send that back again. Thank you.
Joanna, maybe you can stop sharing screen. We can see if there's any questions. Feel free to raise your hand or jump in. In the chat, we have a question about churches. Kathy, can you ask your question, please?
Sure. I'll try to put myself on camera too. Hi, I am just wondering, great presentation. You said, did you interview people in churches, and did you hear how people consider support from their congregations and faith leaders?
Hi, Katie. Yes, we reached out to a few, and we went there. Unfortunately, of course, due to timing, we couldn't talk to a few people due to the time we were there. But as well, my partner Ignacio attended an event. It was in a church about guns, that they turn guns into art. And he was able to collect information from community members that way. Of course, it was the timeline. It was very short, so we did our best between him and I to go around the whole county: Louisville, Lafayette, Longmont, Boulder, and the mountain community as well. And we're still hoping to get more input while this phase 2 continues.
Any other questions about the findings from phase 1? Okay, well, we're doing excellent on time. So we will now have a 25-minute break. We're going to start promptly at 1:45. So please mute yourself and stop your camera and get a good stretch in and maybe even a snack. And we'll see you back here soon. Thank you, Aisha and Johanna, for all you presented.
Amy, you're on mute right now.
Thank you, Johanna. Thank you for being so prompt. We have 2 more short presentations, and then we have time for a discussion about anything that you've heard so far this morning, or any questions that you have about the process or logistics or anything that we can answer for you. So I'm going to turn this over to Dr. Mendez Shannon, who's a Boulder County Community Engagement Specialist, and she's going to talk about equity and accessibility in this process. So Dr. Liz, whenever you're ready.
And also, I'm just going to add that this will be followed by a presentation or a talk from Rebecca Novinger from the Human Services Alliance, who will discuss accessibility.
Great, thank you. I wanted just to say a big thank you to all the interpreters and translators as well. Thank you so much for being here. Adelante a mi gente, que estoy muy alegre que también están aquí. My name is Dr. Liz, that's how I go by. And I'm excited to talk about some opportunities that we have within our scope. It was really hard to listen and hear and embrace some of the stats that were talked about. It was also heartfelt to hear the community engagement piece and know that there are folks really working hard to engage and elevate the voices that are not being at the table or heard, or because of many reasons, for fear or the feeling of not being included, and knowing that time after time. What I want to talk about is very briefly about the process of equity. And we know that equity is about how do we address inequalities. I also encourage the discussion around equity to center race, to center specifically for Boulder County location, and to center other intersectional identities as well. Before I continue with the process, I do want to invite my partner, my presentation partner, to talk about accessibility as well.
Yes, good afternoon, everybody. To expand on what Dr. Liz has started with, we've heard a lot this morning about racial inequities, and those are all very important and the things that we'll talk about and be mindful. But we also have to remember that inclusivity and equity work also involves people with disabilities as well, people of all abilities. An accessible environment is an environment where people of all abilities have the same opportunities to get the same information, engage in the same interactions, and have the same opportunities to participate in community life, whatever that looks like. And it is equally effective for all. Every one of us, every single person in this room is differently abled. Some are more visible than others. And we know that the pandemic, while this wasn't highlighted as much in the slide deck from earlier this morning, we do know that the pandemic has disproportionately impacted people with disabilities in all kinds of ways. People with disabilities have historically been a marginalized and underserved part of our community. And this pandemic has certainly highlighted that, the social isolation, the inequitable access to technology, loss of employment, so on and so forth. And so as we go forward and we have conversations and we listen to Dr. Liz talk about equity and inclusivity work, and then certainly later when we start to build out recommendations and proposals, it's very important that we remember that all of this needs to also be relevant and beneficial for all community members, including people with disabilities.
Great.
I'll turn it back
Thank you,
to you.
Rebecca. Thank you, Rebecca. To continue that, so many of us are expecting a PowerPoint that talks about what is equity and what is injustice, and how do we fill out that checklist so that we know that's not happening. So I'm inviting you to come at this brief few minutes with not only your mind and your heart, but your soul, your sense of what in your culture, what it means to experience the racism, both at school, at the doctors, any place that you go to, and really think about how perhaps you don't have that experience as well. Thinking about what are the intersectional pieces when it comes when you're framing equity. So it's not only about poverty, it's also about housing and poverty. It's also about income and childcare. So there's a lot of intersecting avenues and pathways. And next slide. When we think about the components of being able to promote equitable outcomes, a lot of us really we want to help. We know that there are communities and families and businesses and individuals who are in crises. So we will try to lean into, all right, let me embrace the goals. How am I becoming aware? How am I informed? How can I make sure that everyone has access to the services and what are the outcomes. But I'm going to ask you for 3 other things. Number 1, a call into action to make a shift with your mindset. It's not only about trying to consider the solutions and to stop the suffering, yes, but it's not only about that. It's about addressing and trying to target the root cause. Why is this happening anyway? Because in the pandemic, it was exacerbated. So that's number 1. Number 2 is about, so, all right, we're at the working groups. We know that we're here as the reps for many, many individuals and folks, but who isn't there? Who is not at the table to decide and to help address the bias in the system? Who isn't there to interrupt the regular process and flow of everyday business? And then the third thing is, a lot of folks really believe that when we are inclusive and equitable, we all get along. We all have the same ideas. Yes, this feels really good. I think we're going somewhere. So interrupt the system. If we continue in the same path and mode, we will have the same results. And that is the definition of insanity. We do the same thing and expect another outcome. So be different. Have a different idea. Get into conflict. Be comfortable with the uncomfortableness and ask those questions. So in my culture, mental health is about a church and healers. It's not always about the therapist. In my culture, if we need to go to the food pantry, I don't want pasta. I don't want the beans in the cans. I need some rice, some herbs, the seasonings. That's what I need. So really trying to expand how you can come to the table, interrupt the system, and do better for the situation that we are in now, which is in crises. Next slide. The key tools are in your welcome packet. There are policy links, there's assessment tools. There's a way within also in Boulder County to meet with a board and discuss your ideas around racial equity impact. All of those are available and we're here for you. Thank you.
Thank you, Dr. Liz and Rebecca. We really appreciate that. Before we transition into the next segment, I'm going to take my slides off the screen so we can all see each other. If anyone has any follow-up questions or comments on that. Okay, this group is ready to move along. If any point you do have questions that come up, just pop them in the chat or feel free to jump in and raise your hand at any point. The next section, we're going to cover just some basic logistics for how these working groups are going to function, how you will be able to collaborate with each other, how you'll be able to access like our shared drive. So I'm going to go through some of that, and I'll start off, I think, maybe just keeping the screen as it is for now, because we've been looking at slides a ton all day. So just to start off a few things, I believe 2 of the 3 working groups have set the follow-up meetings. So the economic challenges group, you have already received calendar invites to the subsequent meetings. The mental health and social resilience meetings will be, those invites will go out during our next break, and you'll receive those. Housing meeting, I think there's going to be a follow-up discussion to make sure that everyone is set with those dates, because there wasn't one that became a clear front runner and when to meet up. So that'll be part of your working group discussion. So that's the first thing. just want to note that there are going to be 2 subsequent meetings, as we mentioned, for these working groups. And those will also be meetings that are recorded and posted to the county website for the public to view. In between that time, though, we also expect that there will be some work and some communication between all the working group participants. So that may entail research and emailing things back and forth. And I'm sure each group will end up getting into their own groove of communicating with each other. But we are all going to be resources for you all to also help with that flow of communication and help with the flow of work. So myself and Amy, Dr. Liz, Aisa, and Sophia are going to be supporting those groups to help with some of those administrative things. And just as questions come up, we'll be, at least 1 or 2 of us will be at each of the meetings to help with those. So that's the first thing on just those meetings. Along those lines, if there's anything you would like to request to help with access to the meetings in advance, please let us know. Do not hesitate to raise that with one of us or with the co-leads of the group, and they may talk about it a little bit later on in the working groups. But if there is anything you need, including translations or any sort of Zoom functionality, let us know. And we'll be happy to do our best to try and accommodate that. Another topic, just because this is a public facing role and that these are public funds that are on the table, you may have some press inquiries, and we address this in the welcome packet, but just want to reiterate that when these questions come up from press, we recommend that and ask that you please direct those to the working group co-leads who will address them. And we've also put some responses in the welcome packet about how you may, ways we recommend talking about the process. Again, there's going to be a lot of questions that come up, and we don't want to provide any information before it's finalized. Ultimately, BOCC is going to make the final determination. So when those determinations are made, that is, we hope it'll be, shared out from them. But if others have questions along the way and you're uncertain of how to interact with press, just let us know. All right, and then I think the last thing that we're going to go into is the Google Drive. And I will pull up my screen for that. We're going to put some of these slides that I'm about to show.
Johanna, I'll also put in the chat the bit.ly link.
Oh, perfect. Okay. We will put the slides into the Google Drive as well. Oh, sorry. Before I actually move on to it, I will also add a quick mention that in terms of places you can find information, again, we always recommend returning to the county website. That's where we will try and post all the update information about meetings and where we are in the process. As I mentioned, the community engagement team is here to support, and the press team, Sophia Lenny, is here, who's going to be able to support as well. So there are many, many different avenues to ask your questions as they come up. So I will not go into a full-on tutorial on how to use Google Drive, but we do want to make sure that everyone has a, groundwork for understanding how to use it. Again, we are navigating a very collaborative process in a virtual space, which is a new challenge that constantly has more challenges unfolding. So we do ask for your patience as we make sure that everyone will end up being set up to make sure that they have access. If you have any issues, you can let us know. If you are very familiar using Google Drive on a regular basis, this may be a moment to tune out for a second, but we just want to make sure everyone knows where it is and how to find things. So we highly recommend, to make your lives a little easier, saving the folders that are going to be shared with you. If you're used to using Google Drive, adding a shortcut, as you see on the screen here, by right-clicking on the name of the folder, adding that shortcut to your drive is super helpful. Then it's right there when you open up your Google Drive, or if you prefer, you can add a a bookmark. And I apologize, this is a Mac. I may be different on other computers, and I'm not entirely sure, but happy to troubleshoot with anyone who wants to figure out how to bookmark the tab itself on your computer. So that's the start. Just make sure you have the folder saved. Amy posted the link to the folder in the chat. When you are in it, creating, uploading, commenting on documents is very simple. You can just go to the new button, and that's where you'll see the options to create a new folder, to upload a file, and then to create items. All of the Google Docs are very similar to other platforms you might be used to, such as Microsoft Word and Excel, PowerPoint. These are just Google's versions, and they're much easier to use when sharing and co-collaborating on documents. So clicking on that new button will give you all those options. And then once you have documents that you've made and you would like to share them with your fellow working group members, you can go to the top right and you'll have a share option. And then you can add the person's email. You can also copy the link at the bottom right, and that will that you can send to your fellow collaborators, and they will be able to open the document as well. Once you've shared it with.
I was going to say one thing on this slide, just remember that the default in Google is just to view, but we want everyone to be editors. So you'll have to choose editor next to the name.
Thank you. Yes. And if you are adding the name in, you can go to the right where it says editor and the drop down arrow and change a person's access. Or if you want to change access more broadly, you can click change on the bottom left of the window. And that'll give you a few different options, either to restrict the number of users who can use it, to allow anyone who has the link to view it, to only comment on it, and then finally to edit it. And then I'll go into what it's like when you actually have the document. So let's say you're working on a Google Doc, which is very similar to a Word document. This is the easiest way we find for people to collaborate so everyone can see each other's suggestions is when you are typing, if you want to highlight a word, and then on the right side, you'll have the option to add a comment. That allows you just to add comments. If you do the @ sign and then their name, you can tag the actual individual. And then if you click on the green icon, it has like a little pen in it. That is suggested edits. And that's great because it shows up in a different color for each person. It shows who's made the comment, and then you can accept or reject the edit. All right, and so I think that's about.
Joanna, I'll just add one thing that's different from Word. When you add a comment in Google, you have to click post afterwards. So in Word, if you add a comment, it's automatically there, but in Google, if you have to press the blue button that says post. This gives you an opportunity to edit if you need it. If you do need to edit the comments, you can just go back to the comment and you can press edit, which is the 3 dots on the top right of your comment.
Thank you. And then the last thing I'll add with that is in the Google Drive, you will be able to upload the documents you all want to work on together. But we will also continue to upload resources that we think are useful to each of your groups. And we're going to try and make sure we have already a number of resources available to you. So that will include the presentations from today. And I will upload that. I realize there's one small edit I have to make before I can finally convert it to a PDF and make sure it's in the folders, but that will be available for everyone. We will make sure that you have access to, again, the original presentations to BOCC, along with the preliminary engagement report. Let's see, what else? You will have access to all of the meeting notes from your meetings. You will have
the videos.
Yep, the videos, and then other useful reports that we find along the way that are helpful. So any other questions on that so far?
I'm sorry, I have a question. I am a community member and I'm meeting with other grassroots mental health community members from, oh gosh, 6 or 7 organizations, grassroots organizations. Am I allowed to share the documents or are these confidential and internal to the working group?
Excellent question. We would like them to stay confidential at this point. They will all become public, but to give the working groups a chance to explore different issues before the community or the press or anybody starts kind of zeroing in on one, we ask that you keep it confidential.
So there'll be a point at which certain things are released for sharing. Like for instance, the recording of this event today is released pretty much immediately.
Actually, all the recordings for the meetings will be released immediately, right afterwards, or as soon as Zoom takes about an hour or so until it's ready to be compressed. So those will be immediate, and everything else will release when we can.
Finally, do you have guidelines for how we can talk about what's going on in the working group?
Sure. Those are actually listed in your welcome packet. We have some talking points. If you need anything more, just let us know. I think
actually, I'm asking beyond that because this is about talking with my advocate circle. What can I say and what can't I say as we're going forward?
I think you can let them know what's going on and let them know that none of the decisions have been made until the end. You can definitely explain the structure. There are 3 working groups. There's going to be 3 meetings. You can share with them the report or the slides that Joanna showed this morning. You have links to that in your welcome packet. So there's a number of things that you can do. And if you have any quick questions that you want to know, either ask the co-chairs of your group who are really going to be driving the process, or us, me, Joanna, Dr. Liz, Aisa, Sophia, here to support you.
I'll also add to that I think if there are reports that we share with you all that have come to either the Arpa input email or we've just come across in our general day-to-day work that you think would also be very useful reports to your colleagues or your networks, we encourage the sharing of all that information. Those are already, public reports, but the more that we are able to share those types of resources with everyone, the better.
And we know that they're not usually in one place, and we have done the work to put them in one place, so it might be easy for you. I just we're not shutting off the conversation, but I just wanted to transition to Katrina because the last piece of this morning is really just opening up for questions and discussion just like this. And Katrina is going to be leading that. So just hand it off.
Thanks. So I have my participant box open and my chat box open. And so if you want to raise your hand or put something in the chat, I'll be tracking whose hands are coming up and who's asking questions on chat. And then I would just invite Boulder County staff and possibly co-chairs to jump in and answer questions as they come up. I'm not going to know specifically who really wants to answer the questions. Try to remember to lower your hand. Remember mute and unmute. And I think that's it. So there haven't been a lot of questions in our earlier presentation. So I hope there's a bunch right now, or you all are still trying to digest everything. So, but please, this is an opportunity to get some questions out of the way before our work groups this afternoon.
I'll just add that we have 25 minutes for this, so there's plenty of time.
Anna Fernandez Frank went first.
I think Debbie had her hand up before me.
Oh, sorry. Debbie. I know I looked in the wrong place. Debbie.
Yeah, nice to see you. Thank you. One of my questions has to do with, as you're presenting this morning, just where there's other dollars already allocated by the county so that we have a good picture of like, what is the budget and where are there certain dollars already being allocated towards some of these areas and programs. I just think that might be helpful moving forward. So as we're looking at this amount of money, we can get a sense of either how much more is needed or if there's no funding from the county in those areas that we might want to look at that as a priority.
I do want to say as a co-chair that we have that information for our working group this afternoon to be able to refer back to it.
Okay.
And we will have Boulder County staff's support as we work through some of these projects. We can ask.
Perfect. Thank you.
I don't know if Leslie has something to add to that.
Yes, so we can provide information on the approximately 5.6 million of ARPA funding that has already gone out. We can definitely provide that. And there are other federal funding streams that would be relevant for each working group, and whatever resources I have that we know where we know what those are, I'll make sure that those are added in the working group folders as well.
Great, thank you.
Thanks, Debbie. Now, Anna.
Yeah, I also, if you can adding to what Debbie just said, if you can also add, what Boulder is doing. I don't know, I'm imagining Longmont also received some funding. But my question was more practical. Do we have a schedule for the upcoming meetings? Or is this something that each working group is gonna decide on people's availability? Because it's very intense and I know everyone has very busy schedules. And so do we already have a schedule for upcoming meetings?
If you haven't already received an invitation, sorry, I actually know the answer to these questions. If you haven't already received an invitation to the meetings, you will talk about it in your work group. Some haven't all been finalized yet. So you might want to check your email, or the work groups will be sure to make sure everyone understands that next process. And then also at 12:30, Longmont and the city of Longmont and the city of Boulder are presenting what they are doing with some of their ARPA funds so that we can see what they're spending money on and how their process is going. Kathy?
I want to apologize for being so full of questions. I'm not only a community member, but I like to do interviews. So a question for me is, we have these 3 working groups looking at all these great faces and old friends that I'd love to work with, and et cetera, who I know are in other working groups. And I also noticed that the issues themselves are overlapping. And how do we, as we like to say, deal with the silos that we might be creating? And my specific example is I see that both the economic working group is looking at broadband infrastructure, and that's also intended to come up in the mental health working group. How are we going to coordinate and interact around some of these solutions?
Thank you. Thanks so much for that question. It's an excellent question. So the co-chairs are going to meet every week to do that. They're going to take an hour out of their day on Thursdays to come together and talk about what's happening in each of the work groups to make sure that there's no overlap, or there might be intentional overlap. It is definitely possible that 2 working groups might want to propose the same program because it might help both sides of it. So we're going to leave that open as a possibility. If we think that we need anything more in additional to that, we're going to depend on the co-chairs to let us know, and we can set up whatever we need.
Thank you. Julie?
Yeah, is it possible to provide us with a list of things that can't be funded? We saw a list of kind of the guidelines that could, but some questions that come up are undocumented households as eligible, or blended households, land, capital. Is there any like a negative list or things that you could share with us?
I'll jump in on this one. So on Friday, you received a link to a document that had cataloged every single idea that we got in phase 1. And Leslie Irwin had checked it between eligibility or potential eligibility. Sometimes an idea could be funded if you change it just a little bit. And Leslie is going to be working with each of the working groups to answer those questions throughout this process. So we don't want to get too far on an idea that might not be eligible, or we want her input to show us how it could be eligible.
And I also want to remind people that we are looking at, especially today, we don't want to eliminate anything because we don't think it's funded, because there are often ways to fund things that we aren't always aware of or can think of. And that's another something that the Boulder County staff will help us look at. So we want to be aspirational, and we don't want to be too tough on ourselves about asking for a lot to start, just to make sure we're not missing anything.
And I just want to jump in one more time and just remind everybody what a huge opportunity this is. We have each of the three co-chairs that are going, I'm sorry, each of the three commissioners are going to be sitting in these conversations when they can, or there'll be an extension, you know, an arm extension to these conversations. And they have also told us that they very much want to know what folks are interested in, because you might not be able to fund it through Arpa funds, but you might be able to leverage some state funds or some federal funds or Boulder County's regular budget. So please do keep that in your mind.
Thanks, Amy. Leslie.
Yeah, I just wanted to clarify a couple of things that have come up. So for the broadband potential overlap, I see broadband, the big project, really being in mental health and social resilience. And I mean, I guess both groups could talk about it, but the internet access programs is in the economic challenges categories for Treasury, because you're addressing negative economic impacts where people don't have access to devices or the internet service per se. And we have already approved some funding in the immediate needs category to address digital divide in that way by providing devices and training on devices and how to use them, minutes for phones, etc. And that a lot of that is happening in Robin Bohannon's shop, who is one of the co-leads. But there could be some overlap, but the big broadband projects, I think, live more in the mental health and social resilience category. And then, I was going to clarify one other thing. Treasury does not preclude expenditures that benefit undocumented households, and Boulder County has in fact approved funding for undocumented households in the Left Behind Workers Fund. So that is not precluded, and where it's not precluded explicitly in federal law, we can do it.
There's a question in the chat. Well, two. One, community foundation funds, and they're not a part of the conversation at this time. But Anna Marie asks, given that part of the challenge with affordable housing is the sorry, Anna Marie.
Citing. I think it's citing.
Got it. Oh, I get it. That makes sense. And the sporadic opposition from the community, can any of the funds be used for community outreach and education? And I think, Leslie, I don't know if you have, yeah.
Yeah, I might need to look into that more explicitly, but I think so, because it would be as part of a larger housing development project, and that's part of the process. Whenever we do affordable housing projects, there is that outreach component and getting the community's feedback as well. So I'll say that we can do it with a caveat that I'll come back to you if I look at the guidance and find out that we can't. But for now, the answer is yes.
Great. Berenice, this is in general that there are ways we can help undocumented community members, or was that to a specific question?
Yeah, because I have learned in my experience that sometimes with federal funding, you cannot provide a benefit directly to undocumented community members. But for example, if they support Centro Amistad, the Latino Chamber, or things like that, we can create programs to involve these undocumented members so they can get the benefit.
Great. We still have some time. Does anyone else have any questions? Did I miss anything?
I have a question for the group, but it can wait till others ask any other like clarifying questions, if there are others that want to jump in. All right, then I'll take that as I can go. I was just wondering, and more out of curiosity, who participated, in phase 1 through a community conversation, or who was familiar with the work that happened in phase 1. I'm sure some of you were sharing this information with your networks, and I would love to hear what some of you all experienced during that process. Kathy, I saw you raise your hand. I don't know if you, okay.
No, I was just saying I participated, but I will say that I hope there's an intentional and broad follow-up with the faith community. My partners at the Interfaith Network on Mental Illness, nor some of the housing-related partners working in faith communities aren't really here. And I'm not really representing them, but that's a big area of I mean, the safe lots is in the church parking lot. The mental health providers are people's pastors. So I hope there's some follow-up in the faith community.
I'll just
As a
jump in and
co-chair
add-
for the
sorry.
As a co-chair for the mental health, it will be great to have some of that access as we go forward. And we still have some time for some outreach, hopefully the capacity and time to do some more questions, especially now that we have a network, a connection. So thank you.
I was going to ask Dr. Liz and Aisa if you want to jump in and talk about your role and outreach going forward.
Yes, we so Aisa and I are in support of the community engagement and outreach work. We know that there's lots of opportunities to reach and to send a message, and we know that it's not always online over the internet. Door-to-door nonprofits and churches and the libraries, but also the schools. We know that the radio is also a good way to reach out as well. We're here in each of the working groups to support the process and to help with what you need as it comes up, to also be able to mobilize any groups in the community that you would like to vet your ideas with later on. Not right now. So, but if you know there's already a group, it's great to bring that up when you meet in the afternoon.
I just want to add that, of course, we will be in, Dr. Liz, I, and Sophia will be in each working group, and we'll be helping with how the co-leads and the group wants to lead community engagement. This is going to be looking different in each working group, depending on how do you want to get to that like feedback from community members or communities that are not on the table and that you want to hear the feedback on all of the ideas. And we will support that. We know in this phase 2, we will have all of you to help us get all of those ideas from community members that we didn't have the chance to get feedback due to timing. Phase 1 was really 6 weeks, and we were 2 people trying to gather all the ideas from Boulder County, all Boulder County. And what we accomplished was very big, but we know we missed some areas. And now in phase 2, I know that we will help all of you to get to that feedback that we were missing. So
Any other questions?
All right, thank you, Katrina, for leading this. We're
No
now going to take a
problem.
lunch break and we're going to meet back at 12:30. We're going to be on the same Zoom when we come back together. So we'll see you here in an hour. Thank you, everyone. Is policies and is the ARPA allocations in Boulder and Longmont. And ready once Elizabeth and Harold are ready. And please let us know if you would like us to share slides or if you would like to share your slides.
This is Harold. I'm on and I can share my slides.
Okay, you should be able to.
And I'll pull up, I have Elizabeth's here, but just wanted to give a moment for people to see this agenda in case they want the visual. So just a moment. And as we go into the second half of today, just a quick reminder that if you would like to be in the Spanish channel, please select that on the bottom right. Even if you would like to listen to this meeting in English, please still select the English channel down the bottom right, and that will ensure that we get translation across both. And then as a reminder for everyone who's going to be presenting this afternoon, just try to keep a slow pace as much as possible so that the translators and interpreters can catch everything. And I'll hand it over to Elizabeth.
Thank you so much for having me here. My name is Elizabeth Crow, and I serve as the Human Services Investments Senior Project Manager for the City of Boulder, HHS. I'm part of the City of Boulder's ARPA staff team, which is led by our Senior Budget Manager, Mark Wolf. And that, along with an ARPA executive team, includes staff members from very diverse departments across the city, including finance, community vitality, data, policy, and HHS, including Kurt Fernhaber, our department, HHS department director, who is a part of these meetings as well. So what I'll do is fairly quickly go through some summary slides that we used when staff presented to City Council, City of Boulder City Council on February 15. There's a lot more information, as I know you know, and happy to share that. But I think what we'll do is I'll go and then Harold will present, and then we can have kind of Q&A for both City of Boulder and City of Longmont, if that makes sense. So as you can see here, we have 5 basic criteria on which the city staff began to construct our Tranche 1, Tranche 2, and Tranche 3 ARPA investment proposals. And they're built on the foundation first of our citywide equity, sustainability, and resilience goals. And then, as you're also charged as well, really focusing on a variety of other criteria, including, where we have the greatest need, born of the greatest disparities created by COVID and those that existed pre-pandemic. Partnership opportunities that can create opportunities to leverage our investments. And then making sure that we're really being innovative where we can. Acknowledging that for many of our community members and many small businesses and other nonprofit institutions, the need is very much still focused on response, not even yet recovery, because people are really struggling. Next slide, please. So how do we know what we know? We're fortunate to have, as city staff, some relationships, good ones, consistent relationships, close ones, with many in our community. including our businesses and business leading organizations, our nonprofit organizations, many of which are represented on the in the meeting today, our community connectors and other cultural brokers and community liaisons, people we serve directly through HHS and other programs. And so we know what needs are because we hear them communicated every day and every week and throughout the pandemic. This is not to say that we would profess to have a complete picture of what those needs are. I don't know that any government would say we ever do. But we wanted to be able to start from the needs that we know, again, because we've been working with our community partners really closely throughout the pandemic. We also know through the county process, we're blessed to have great relationships with many of our county colleagues and communicate frequently about our investment programs, other direct services, on an ongoing basis, and hope to continue to be informed by processes like this one. Next slide, please. So as I mentioned, on February 15, city staff took our recommendations for our Tranche 2 and Tranche 3 investment proposals to council. And based on the distinction really is based on the projects that we feel confident and comfortable are ready for implementation, either because they reflect, again, some of those urgent needs that we already know of and can make investments right away, and some new innovative projects that are ready to begin implementation. And Tranche 3 is really reserved for those program areas or those areas of need where we need to have more planning and collaboration to make sure that our dollars are really leveraged in the best way. Next slide, please. This is just a brief one. I'm not going to dwell on it, but just to let you know it exists in the slide deck that just makes a distinction of where what the dollar amounts associated with these various tranches. And I can see not all of the numbers are actually showing up here. I might need to click through, but in any case, happy to provide more information as to which numbers go with which of the expenditure buckets. Thank you. Oh, you can go ahead. Thanks. So this is just a reminder of what we have, what we allocated for Tranche 1 that was approved in September 2021. And actually, Joanna, so there were a lot of slides in the deck that were hidden. So we can kind of jump through, and I'm not sure if they kind of came through on your end. But let's see if we can go, to the Tranche 2 recommendations. Great, thank you. So just a quick note then about these Tranche 2 recommendations. Just want to call your attention to 2 lines here. The first one called Continued Housing Human Services Recovery, and then about halfway down, the Continued Economic Recovery Programming. Those are 2 chunks that are really reflective of our investments from the coronavirus relief funds from 2020 and 2021. And those are for things like on the HHS side, direct financial assistance, urgent needs regarding food, health care, urgent childcare expenses, other kinds of financial assistance to help people in their response. And then similarly, the economic recovery programming are the kinds of small business supports that our community vitality department made available to small businesses and have plans to do more of that. The other rows here really reflect more of the innovative approaches, some of the systemic approaches to things like for things like a guaranteed income pilot program, the Building Home Project, which is about connecting people who have recently transitioned from being unhoused to housed with essential services so that they can thrive and stay housed. The arts and culture industry support, the reestablishing programs for artists, Fiber, right, looking at broadband beyond that which is allocated from Tranche 1. And the Emergency Response Connectors Program, which continues to support a very critical community-based grassroots cultural broker network to help advise the city on all COVID matters and to make sure that information about services and needs are coming directly from community members in the greatest need. Next slide, please. Our Tranche 3 initiatives, again, are the areas of which we know are very important, in many cases critically important, things like childcare, mental behavioral health, but for which we need more time to plan and collaborate, including with partners like the county. So you can see here that at least one of these program areas was mentioned in both Tranche 2 and Tranche 3. That's our guaranteed income pilot proposal. What we want is to be able to start making investments to set up the structure for that kind of program, and then be able to, in Tranche 3, actually allocate the funds necessary to support community members who would be eligible for the program based on criteria yet to be determined. So that's at least one instance where there's kind of like a phase 1 and phase 2 approach that we've proposed. That might change a bit, but for now, that's what we've proposed. And staff are working internally to, based on input and comments, questions we receive from City Council, to make sure we go back to them in a couple of weeks with a more specific proposal for adjustment to budget. Some of the other programs listed here are manufactured housing community support, second mortgage program, something that would be more of a pilot, some of which may be connected to San Lazaro community annexation. Just again, more examples of where we've identified a need, but definitely want to have more community engagement, more planning, and continue to lean into collaboration opportunities, including with the county. And then the last slide, just a very quick overview of our next steps. As I mentioned, we will be going back to City Council a little bit later in March for an adjustment to budget. We are continuing to implement some of those elements from Tranche 1 and start to capture reporting for expenditures that have already taken place. And then in the next several months, continue with community engagement, planning, and again, hopefully more coordination and collaboration with our partners at the county, City of Longmont, and our many nonprofit and business partners as well. I've put at the end of the slide my contact information and that of Mark Wolf, our budget senior manager, who is our ARPA team lead. And either one of us, Kurt Fernhaber, others in the city would be more than happy to address questions. I'll stop there and turn it over to Harold.
Good afternoon, everyone. I'm going to share my screen. I can talk fast, so I'm going to try to be pretty intentional in slowing down. Really want to start off with really the statement that you see below. This is a presentation, part of the presentation we gave to council, but really planning for community transformation. When we started talking amongst staff, but also talking with the city council, I think one of the things that really started showing itself very quickly as we looked at the ARPA funds was really transformational projects that really hit those core issues that we've been seeing within our community and what we've been doing. So the city council, as we talk to them, they have their work plan, and they base their work plan and needs of the community, and really wanted staff to focus on a few things. And you can see them on this list: affordable housing, healthy childhood environments, organizational capacity and data management, whole neighborhood projects, and then household business and individual assistance. And I'm going to talk a little bit about what we were looking at in the broader sense. So what we were seeing, one of the things that we talked about with the City Council is really maximizing the use of the ARPA funds that are coming to communities and really understanding where other funding sources exist where we can utilize that. Also really based it on work that we have done since the flood. And so after the flood, we worked and really engaged in Resiliency for All, which was really focused on what we do with our neighborhoods in terms of neighborhood resiliency and sustainability, which is really what we built our neighborhood cultural broker program off of, and really identifying the needs within the neighborhood. So that was one plan that we already had in place. And we really talked about, was it relevant? And when we determined that it was still relevant, we didn't feel like we needed to plan more on that because there was so much we had to do on it. The other thing that we anchored off on in the conversation is frankly the conversations that we had as a county a few years ago when we talked about the most pressing issue facing us today is affordable housing, and now add attainable housing to that conversation, and really looking at the 12% goal that we've placed that each of our communities agreed to hit, and really how could we really shift the needle on the affordable housing piece very quickly. And then tied in the council's goals that they had within their work plan in terms of what we needed to do. So the two anchor points was really the work of Resiliency for All and our affordable housing goal of 12%. So when we looked at this, we didn't really break it down into tranches. We looked in aggregate because we were trying to figure out what we needed to do. And so in this, you can see the ARPA fund that we received at $12.9 million. And when we started looking at some of the projects, we knew that we needed to bring in additional city resources in order to really make a difference. And so you can see about $3 million that we're pulling in from the city's affordable housing fund. As a point, one of the things that we've done over the last few years, we finished it about 2 or 3 years ago, is in addition to the revenue that we're getting from our inclusionary housing program, we also put $1 million a year of general fund dollars into our affordable housing program. So we were going to tap into that. And then using about $750,000 of our general fund that we have plugged in for early childhood work. And you'll see that on the remaining slides. But in aggregate, really, you can see $11.8 million going into affordable housing, $1.2 million in healthy early childhood, $2.2 million in whole neighborhood projects, and then 1.3, which is really capacity and data management for us to operationalize many of these things. So when you break down the affordable housing projects, many of these are going right now. So you can see Sunset Heights, we're working on with Element Properties. We've looked at about 1.3 million in there to make that deal work, especially if we're not successful in some of our tax credit applications that we have in. And then Chrisman Development, we went in the 4% non-competitive, but the pricing increases we were seeing was really pressing that project. To give you a sense, Chrisman, the LOI was signed a week and a half ago, and we're moving down the final pieces on the financing, and so that hopefully will be under construction in the fall. And then Sunset Heights, we're waiting to hear on our tax credit application. Many of you may or may not know this. The city recently, about 2 years ago, also took on the Longmont Housing Authority. And so as part of that, one of the things that we were really seeing in our housing authority properties is it's really independent living. And we were seeing a number of folks in an independent living environment that really needed assisted living. But unfortunately, there wasn't any affordable assisted living opportunities. And so we've plugged in about 1.7 to start looking at partnership opportunities for some type of affordable assisted living component. One of the things that we also know, and this is really coming out of the Chrisman and Sunset Heights projects, is really the partnership model and development activities. And so we knew we could probably leverage the dollars and get more units by soliciting partnerships. And so the Housing Authority owns some property that's been vacant for a number of years off of Hover and 17th, and we're looking to engage into a development project with a partner. And instead of it being housing age restricted, that's going to be more of a family style unit, and really exploring some opportunities with some of the manufactured construction that we're seeing. If you're familiar with Indy Dwell or Fading West, really looking at those opportunities to maximize what we can do in the location. You see Costco property. We actually purchased 9 acres of property for affordable housing associated with the Costco project. We got a really good deal on that, probably pricing that we would have seen between 2012 and 2015. So we couldn't miss that opportunity. The other thing, you go, why is Nextlight bulk agreements in here? We really didn't look a lot at the digital divide because we're really maximizing other federal funding opportunities because we do have Nextlight here. But this is also really to create bulk agreements in all of the affordable properties that we manage to provide internet to all of our residents. You see unhoused option. So one of the things that we know that we're challenged with as communities when it turns into, when we look at affordable housing is, and we think there are some partnership opportunities with the county, Boulder, and other communities, but really putting some seed money in there to look at a more long-term solution in terms of our unhoused population. We also recommended to council to purchase from our stormwater fund, which was really connected to the Resilient St. Vrain work that we're doing from our stormwater utility, the remnant parcels there for affordable housing. And if you're familiar with Longmont, that's really the area off of Main Street, just off of Boston. And so this all ties into the broader goal from our Housing Authority Commission side of really looking at the construction of 6 affordable housing projects in the next 3 years. And so we were looking at how we could utilize this to really make a significant difference. And then we put about $500,000 in because if you're going to run all of these projects, we really need staff, development finance position to augment what we're doing. So you're seeing the bulk of the $16 million going into affordable housing. Early childhood, you can see that we're putting about $1.2 million in. That is $250,000 for data work to really understand what's needed. We know COVID has changed the world dramatically. $500,000 into early childhood health and $500,000 into early childhood care assistance. And then the whole neighborhood program projects, $750,000 in programming and support. Another $750,000 into resiliency and recovery, and another $750,000 into neighborhood enhancement, really focusing on the qualified census tract. So what you will see embedded in this is we really looked at the safe harbor provisions within the Arpa Act to ensure that we could avoid the potential for clawbacks. And so that'll really be focused on the qualified census tracts. And then really what you see in organizational capacity, it's really to support all of these other programs. And so reworking our neighborhood engagement portal and a customer relation management software so that we're really working with our residents in one portal so that we can maximize our communication ability. But then as we're working on some of these neighborhood projects, we have the infrastructure in place to really help us manage it. We're putting $250,000 into our Longmont Caring Community, which is part of that individual assistance. And then when you look at the staff, you can see an individual assistance liaison. We know there's a lot of money through the county and other places for individual assistance, and it's really how do we help other agencies by facilitating our residents tapping into these other state programs. And then obviously the accountant, what we learned through the flood is you need that accounting support. And then some self-sufficiency work at 1.3 million. And so that's generally what we talked about with our city council. I'm trying to stop sharing, but it won't let me.
Do you see a red icon that says stop share, or perhaps sometimes if you hit escape, the button pops up?
Yeah, it just showed up. It was something weird. So that's generally where we're focusing our Arpa funds. Obviously, you can see the bulk of that is really going into affordable housing. We were fortunate as a community when we looked at some of the financial impacts where you could use Arpa to bridge some of that. We didn't have those issues. And so that's why you're not seeing anything in terms of bringing those financials in to support our organizational work. Be happy to answer any questions.
Just a reminder that these slides are going to be, or already actually in your Google Drive folder. If you want to refer back to them at any time.
I see we have a couple hands raised. Stefka?
Hi there. I'm Stefka Fanchi with Elevation Community Land Trust. I had a clarifying question and then a related one. So it looks like most of your affordable housing dollars in the plan you already have projects identified. So I just want to clarify that that was true. And the related question is, looks like you have some different types as well, but I didn't hear anything about affordable home ownership.
Pardon? You cut out.
Oh, I apologize. Do you have any? I saw the unhoused, I saw rental projects. I have not seen anything about affordable home ownership. So have you made that in that planning? Where does that fall in?
So I think really when we look at the 9 acres that we talked about associated with the Costco project, that's probably where we're going to explore that in some of the partnership opportunities. Because of what we're dealing with the housing authority right now and really needing to work the broader financials there, many of those are probably going to be more geared to that, just based on the work that we're doing. But I think where we will really explore, it's on the 9 acres.
Thank you.
And that's not to say that we're not looking at it as part of our broader affordable housing fund. This is just what's really specific to ARPA because of the time limits.
Great. Rebecca and then Kurt, I think we can squeeze in 2 quick more questions.
Yes, this question is for Elizabeth. Can you speak a little bit more about the guaranteed income pilot exploration, please?
Sure. I'll try to be brief, as I think some of you know I could talk about this all day, but happy to follow up. So some of our city staff have been researching guaranteed income or cash transfer programs for a couple of years, including pre-COVID, and see that as an opportunity for us to really complement the number of financial assistance programs we already either have or support through other nonprofits in the community, in that the programs have really been proven to be quite successful at meeting many different economic, health, wellness, academic type outcomes at more of a community-wide level. And so while this kind of cash transfer program wasn't really eligible for or not really efficiently possible to do with coronavirus relief funding, it is possible to use ARPA funding for a cash transfer program like guaranteed income. There are about 60 different pilot programs in development right now, including all over the country, including some other cities that are also using ARPA funding to help launch and support this kind of program. But basically how it differs from another kind of financial assistance program where a government or a nonprofit would help pay someone's rent or help pay medical bills or utility bills or that sort of thing, is that it's a cash payment that goes to an individual based on whatever eligibility criteria the agencies determine per month. Usually a pretty common amount is $500 per month to eligible families for a year, year and a half, 2 years. And there are no conditions as to how they can spend that money. Many people do spend it on things they need that they might otherwise be requesting for financial assistance. There are a lot of other details with the program, but that's essentially what it means and what we would be looking to do. I hope that's helpful.
Kurt, I see you have your hand up. If you have a quick question, I think we can squeeze that in, but we're going to turn it over in a minute to the Urban Institute.
Thank you. This is a message for Harold. Harold, good to see you and hear your presentation. I did have, and I'm really excited about your focus on affordable housing. The one question I have is the 1.5 for you mentioned long-term solutions for homelessness. And I'm just wondering in more detail what that looks like. And if you can't respond in this time, you could have Karen or others send me something. Thank you.
Yeah, I think we don't know. I mean, is the simple answer. And what we do know is that I think similar to the approach that we utilized as a county when we came together to set the 12% goal, this is something that is probably going to take all of us, all communities, the county, and really kind of echo how do we partner on something like that. But we do know when we look at our community, we're going to need a solution as we look at some of the opportunities that are presenting themselves. So I wish I had a better answer, but I think we don't know, but we wanted to earmark that money so that we could position ourselves so we could partner with others to look at a broader solution.
I appreciate that. Thank you.
All right, we're now going to turn it over to our guest presenters from the Urban Institute. Thank you so much, Elizabeth and Harold. That was exceptionally helpful, and I'm sure our working groups will have follow-up questions in the coming days and weeks. So, Madeline, would you prefer that I share my screen, or would you like to advance your slides?
If you want to go ahead and share, I can just tell you, or we can just kind of give you an advance cue if that works.
Yeah, absolutely.
Awesome, thank you.
And while we have everyone on the screen together, why don't you go ahead and introduce yourselves as I'm pulling up the slides.
Absolutely. Hi, everybody. It's really lovely to be here today. My name is Madeline Brown. I'm a policy associate at the Urban Institute. I will give a little bit more background on sort of our roles, but want to just hand it over quickly so everybody from Urban can say hello today, so you know that we're here. So Tina, do you want to come off mute and introduce yourself?
Sure. Hi, everyone. My name is Tina Stacy. I update my name, it still says Christina. I'm a principal research associate at Urban. I'm an economist by training and happy to be here. Thanks for having us.
I guess I'll go next. Kate Reynolds with the Urban Institute. I'm a principal policy associate with the Institute, and I'm a neighbor. I actually work remotely from Denver, so happy to be here with everyone today. And maybe Courtney, is Courtney on with us?
Yes.
Thank you, Kate. Hello, all. My name is Courtney Jones. I'm a Senior Policy Program Manager at Urban's Research to Action Lab. Very excited to be with you today. And I think the last member of our team, Julia.
Hi, I'm Julia Payne. I'm a research analyst at the Urban Institute on the Income and Benefits Policy Center. Hand it back to Madeline.
Awesome. All right. So thanks again for having us today. We're really excited to be here. So I work in the Research to Action Lab within Urban, where we focus on translating our broad bodies of research to policymakers and practitioners like yourselves. So this is really exciting for us. We were thrilled when Amy and Johanna at Rebuild reached out to us in December to share a little bit more about the work that you all are doing and ask us if we could offer some insights from our past work. Amy learned of us through a brief that I, along with Julia and Courtney, who just said hi, wrote last year on policies and programs for inclusive and equitable recovery. That paper created a framework for equitable policymaking in an economic recovery and offered some examples of other cities' efforts. And they thought, and we agree, that that framework might help offer you all a way of approaching some of these policy decisions that are before you. So very excited again to be here, and I want to thank Kate and Tina as well for jumping in. And so, Johanna, we can actually go all the way just to the agenda slide, and I'll walk us through kind of what our plan is today, even one more. Perfect, thank you. So we've reviewed your steering committee's materials, and we understand that you have these three focus areas: housing, income and affordability, and social resilience. So we plan to spend today doing three main things. First, I'll provide just a little bit of background on Urban's work in inclusive recovery, including that paper that got us here and the framework that we sort of suggest cities and counties think about in these decisions. Then we'll go into some of the local examples of ARPA expenditures in those focus areas. I'll start off with affordability and social resilience and then hand it over to Kate, who's going to cover some housing specific examples. And then lastly, Tina's going to offer some evidence-based ideas for advancing equity through a broader sort of housing policy foundation. And I do want to just call out, Kate and Tina are going to focus mostly on housing because that's their area of expertise, and because we see stable and affordable housing as really fundamental to anybody's ability to achieve some of those other things: economic stability, social resilience. So we will cover all three areas. We know they're all really important, but I did just want to make sure that we call that out before we go forward. So we can advance to the next slide and one more. So a little bit of background. Urban really got into this work in 2018 with a report which Tina, who's on this call with us today, actually co-authored. And this report did a number of things for us. It created a definition of inclusive recovery and some building blocks for cities to follow and counties when striving towards inclusivity, which you can see on this slide. It also created a methodology for actually measuring inclusivity and an index of 274 US cities, which we can share out later, the link. But importantly, I want to just sort of call out some parts in this original definition that have been really grounding for us. So we think about an inclusive recovery occurring when a place overcomes economic distress in a way that enables its residents, especially historically excluded populations, to share both in benefiting from and contributing to economic growth. And again, this definition has really sort of grounded a lot of our work in this space. As soon as the economic impacts from this pandemic started to sort of come to fruition, we found ourselves returning to it, returning to this work, and starting to kind of keep a list of some of these policies and places that we noticed were really trying to center equity in their work. We all on this call, because we're in sort of that research translation space, work very closely with cities and counties like yourselves. And so we observed that this was just the challenge that kept coming up for folks trying to do this. So we were both sort of bringing it to existing work that we had, existing places that we were already engaged in, like Ramsey County and Fresno, and also hearing from folks directly like you all in Rochester coming to us and sort of asking how to be able to center equity in these recovery efforts. So we can go to the next slide. So one of the first things in 2021, as we were sort of revisiting this work that we wanted to do, was really call out and create a distinguishment between inclusion and equity. And so In the literature, definitions of inclusion sort of vary in the way that they focus on sometimes end goal, sometimes process, sometimes specific populations to be inclusive of. And we wanted to make sure that we include in that definition both that process and that end goal. And it's why we're really excited to be working with you all, because we know that that community engagement, that inclusion as part of the process has been so key for you all. Equity, on the other hand, we wanted to really bring forward in this sort of like updated revisiting of this. And we think about it as a state that refers to fair treatment and equal opportunities and accessibility to resources and information. So really in the written work that we've done, as well as some of the technical assistance we deliver, we push for inclusive processes wherein the ultimate target of a state of inclusion and equity justifies targeted and specific actions that acknowledge the racist histories and systems that exist in this country. And this sort of theoretical background is important. We can go to the next slide, because we really see it come to fruition in some of the data on the impacts of the COVID pandemic. And this reigns true sort of regardless of which recession you look at in this country. So these charts are both from August of 2020. On the left, you'll see adults in households where somebody was expected to lose some employment in the next month. And then on the right, renter households that are not caught up on rent. And you see these very close correlations and also pretty severe disparities across racial groups. So nearly 40% of Latinx families, nearly 35% of Black families had somebody in the household who was expected to lose, again, some employment income in the next month. On the flip side, nearly 1 in 5 Latinx families, nearly 1 in 4 Black families were not caught up on rent. And so again, we're just thrilled that you all are sort of taking this really inclusive approach, and that lines up very well with the way that we think about the sort of theoretical background of inclusive growth and recovery. So next
Madeline,
slide.
can you slow down just a little bit for the interpreters?
Yes, of course.
Thank you.
Next slide. So in 2021, with the grant from JP Morgan Chase, we set out to kind of revisit that definition and just create a framework that felt more actionable and inclusive of examples of some of the things that we wanted to call out. So we created this 3-part framework for cities and counties to think about the policies that they were sort of proposing in this recovery. So the first bucket being addressing policies that had policies and programs with harmful impacts. Second bucket, targeting supports and opportunities to historically excluded communities. And lastly, exploring policies that can eliminate structural barriers. So we can go to the next slide. I'm going to walk through just quick examples in each of these to kind of give you all a sense of what exactly this means. So addressing policies and programs with harmful impacts, we think of these things are things that already exist that cities and counties actually have leverage over changing. So in San Francisco, in the onset of the pandemic, they really looked inward at what debt did the city hold that was disproportionately impacting families of color in San Francisco that they could just release as part of really sort of recovery efforts. And so they created a number of policy changes to their fines and fees across criminal justice, things like parking tickets, halting collection in a range of domains, but really just sort of canceling any debt that the city held, and especially having done some of the data work behind it to relieve some of the racial disparities in that debt collection. Targeting supports in Broward County in Florida, they created a program which targeted residents in 6 zip codes where there were high unemployment rates, low educational attainment, and low household incomes. And then the community college really relied on partnerships with CBOs, local government, and employers in those areas to actually be able to provide courses in those specific targeted zip codes and include free training and wraparound services. And then lastly, in this sort of structural bucket, if you will, a lot of jurisdictions have started to think about ways to use these recovery dollars and other stimulus packages to reduce the racial wealth gap. And baby bonds is a policy where you seed a certain number of money for every child within an eligibility criteria in that district. And it's a publicly held trust until that child is 18. And so this was legislation that actually passed in DC last summer, and we are seeing it pop up in states all across the country right now. So we can go to the next slide. And so we're going to now kind of dive into some of these examples of ARPA expenditures. And as you hear about them, I think it's important to kind of think about, you know, in which of these areas are we thinking about targeting supports? Are we thinking about reducing structural barriers? Or are we thinking about fixing things that are having disparate impacts and that they're not necessarily mutually exclusive? So we can go to the next slide. So as I mentioned, I'm going to talk through affordability and social resilience. And we wanted to provide some examples of policies in these that really were responsive to some of the community input that we saw in the materials, and to provide just some really sort of concrete details. So I was actually excited when I jumped on this call to hear that direct cash transfers were already sort of being discussed. So I don't think I need to spend too much time here, but there are some really good concrete examples. And I just want to call out San Diego County has already allocated $40 million to a direct cash program. So they would be a good sort of comparison, I think, for ARPA spending specifically. And then in DC, we had a direct cash transfer that was pandemic response, but not using ARPA dollars. It was actually privately funded, and Urban recently did an evaluation of that program. So I can get into some of the eligibility criteria if people want to know more about that later, but I just think this chart is really helpful because you can see the categories that people are spending in. Obviously, the flexibility is really important, but I think it was Elizabeth was talking to her point, it's a lot of basic needs too. Over 80% of people are still spending some of these dollars on housing. So this is one, and I just want to also call out, this came up in the survey with your residents. Okay, and then childcare for affordability too. So though we know much of childcare spending is controlled at the state level, there have been county examples of governments moving in the space with ARPA dollars too. So about 68% of county ARPA plans did include some investment in human services and children and families. In the area of childcare, we had, you can see some of these icons, some of the different examples of types of childcare expenditures. This is ARPA dollars specifically. But in things like workforce development and subsidies for high quality childcare. One example is Cumberland County in Maine, who are using these recovery funds to develop a specific workforce training program for childcare providers. We can go to the next slide. And then in the area of social resilience, I'm going to talk about some mental health service examples and some broadband service examples too. So on the mental health side of things, there are at least 34 jurisdictions nationally, including 18 counties, that are allocating some portion of their ARPA dollars to mental health. One interesting thing you can see in this table, and you'll have all these slides after the presentation too. In mental health, there were different Treasury eligibility use groups that were utilized. And subgroups as well. That's different from broadband, where people are typically sort of in one category. Range of expenditures here, everything from increased crisis care, actual acquisition of facilities and shelters, needs assessments, new hotlines, and then also a lot of targeted increases in counseling at schools and other specific target populations like homebound seniors as well. This table has a couple of county examples, two that we can sort of call out: Knox County in Tennessee, who are spending about $850,000 on an actual new facility to provide urgent psychiatric care. And then Fort Bend in Texas, Fort Bend County, who's funding a specific expansion of the night shift of their mental health hotline in the county. Next slide. And then lastly, getting to broadband, there are at least 39 jurisdictions that are investing in broadband infrastructure, including 29 counties. Major spending areas that we're seeing here, things like hotspots and devices, middle mile and last mile broadband expansions, upgrading fiber optic infrastructure, and then again, a lot of needs assessments are being funded as well using ARPA dollars. So 2 examples here in Broward County, they've programmed about $1 million for some of that fiber optic infrastructure. They already have deployed public internet connectivity in some of their parks. And so this is really an expansion of that, that actual infrastructure. In Chattanooga, this is an example of a place that had actually used American Recovery and Reinvestment Act funds to deliver fiber optic internet at a low cost. But many folks, especially rural residents, were still unable to access it. And so building on what was a student hotspot program during the pandemic, that city-owned utility actually partnered with the county and the city and the school district to start to install routers and wire eligible families' homes, and then waiving all fees for service. So we're seeing different ways of going about this. And again, we'd be happy to kind of talk about these examples and also encourage folks to continue looking at other trackers that exist of sort of continued detailed examples. But going to turn it over to Kate now to talk about some of the housing expenditures.
Thanks so much, Madeline. All right, I'm really happy to be here today. So as Madeline said, I'm going to talk a bit about housing. And I did some early research on how cities across the country were planning to use their state and local fiscal recovery funds for housing. And I will note that since I conducted this research, there have been some great new resources by Brookings and the National Association of Counties, among others. And I provide those links at the end of my presentation. So I hope you all will find those useful as well. So in our research, we looked at cities with populations at 250,000 or more because they were required to submit a plan by the end of August. And we were doing this research at the end of last year. We didn't have the resources to look at all the plans of all the cities. So we used a measure of risk of housing instability and identified places with high levels of housing instability. We also included Honolulu, which only had 3 tracts that met this definition, but we wanted some geographic diversity. So in the end, we reviewed 29 cities, and you can see the results here. So in our analysis, we found that basically of the 29 places we reviewed, only 4 had no housing priorities listed at all. And the vast majority listed more than 1 housing use for their ARPA dollars. So many, many places around the country are really prioritizing housing with this funding. Many of the
Wait, are we missing any, or might be missing some of the names of the places?
No, I didn't include the names of the places here, Amy. I can provide those afterward. All right, just quickly. So essentially, places mostly were using these funds for either homelessness services and also affordable housing construction and preservation. In addition to these 2 uses, there was a broad range of housing priorities articulated in the plans, for example, rental and utility assistance, foreclosure relief, and residential counseling. And there were many places, so almost half of the places that you see here at the bottom, that are doing relatively unique housing uses depending on their local circumstances. So I found that really interesting. They're really kind of stretching the guidance from Treasury. So for instance, Pittsburgh is supporting community land trusts. St. Louis is instituting a real property tax assistance fund. And Detroit and New York City have mentioned in their plans supports for small mom and pop landlords. Next slide.
Yeah, I think you might be looking at something a little different than us.
No, I don't think so. At this point, I'm just providing an overview of the graph that was represented, and then I'm going to go into examples next.
I think the row labels were not visible to people on the slides. I think I could.
Oh, I see.
I could see what you were reading from, Kate, but I think the text was not available to the audience. So I think all you could see was the blue bars, but not the categories of expenditures that label on the left hand side.
Oh no. Okay, that's bizarre. Well, they were clear in the slide deck. I'm so sorry. Let me see if I can actually pull it up here.
I can also try my screen. I can see them on the version. Maybe if we want to switch, or we want to just keep going.
Would it be helpful to show the graph with the X and Y axis?
Yeah, I'm wondering, because if there are other things that pop up, it'd probably be better. I'll stop sharing my screen.
Can everybody see this?
Is that helpful?
Yes, this looks totally different. Thank you.
All right. So I'll let folks digest this for a second, but basically, as I said, affordable housing development and preservation had very high levels of places around the country who were doing those types of things, as well as homeless services. And then, like I said, places were also being really innovative and like kind of articulating things that were a little bit outside of the main categories that Treasury put in their guidance, but still fit the mold of the guidance. Okay. So in my remarks today, I'm going to focus really on the ways in which cities plan to use funds for immediate housing stability. And then Tina will talk about longer term housing policies and strategies to promote affordability. So many places stated that they plan to use funds for eviction and foreclosure prevention. And there have been some really innovative ways in which cities have said that they would do this. So for instance, in Detroit, they're creating a city locator service to help folks find affordable housing and also providing some wraparound case management services. New York City in their plan actually articulated a goal of reducing the unhoused population by 50%, and then sort of articulated strategies that they would fund using the ARPA dollars to meet that goal. Next slide. So many places opted to use a portion of their funds to supplement rental or mortgage assistance that was already being offered through other tranches of funding. I thought Santa Ana's example was really interesting because in addition to rental assistance, they actually were providing folks with $6 million in prepaid Visa debit cards in areas with high rates of poverty. The cards were valued at $300 and could be used at any businesses that accepted Visa. But in addition to providing these cards, Santa Ana also allowed businesses, local businesses, to sort of offer discounts to folks using the card. So they also sort of incentivized the folks to use cards at local businesses. So I thought this was an interesting kind of two-pronged strategy.
Hey, we have a question in the chat asking if you said that a jurisdiction created a property tax assistance fund.
Yes, yeah, St. Louis did. So I don't know how much is, at this point, the plan has little details, but there may be more on their website at this point. But that was St. Louis. All right. So just quickly on Portland, the foreclosure prevention counseling, they're basically taking what they already had in place in terms of foreclosure, but offering some HUD certified counseling as well as additional financial assistance. So as you can see, places are sort of beefing up existing eviction and foreclosure prevention strategies. Next slide. So I'd like to just take a quick moment to talk about eviction diversion programs. To be frank, even though I'm a housing expert, I didn't know what these were until the pandemic. But the reason I'd like to mention them is because the White House and Treasury have repeatedly stated that state and local fiscal recovery funds can be used for this purpose. And the White House has really made this a priority strategy. So in June of 2021, the White House held a 50-city summit in which it asked a range of stakeholders to commit to creating such programs. And early research findings show that these programs can lead to less eviction. I also mention them because Boulder has a recent right to counsel in eviction and provides rental assistance that's dedicated to renters facing eviction. So I feel that Boulder has many of the pieces in place to make a more robust diversion program possible. And this is even more important now that the national moratorium and local policies are ending. So I would just direct you to two great resources. One is Urban Institute's study of diversion programs across the country. And this will give you a good overview of the components of the programs. And then a second is the National Center for State Courts, which offers a diagnostic tool. And essentially there you can enter information about your specific court system and what you're already doing. And it will give you a set of recommendations in terms of how you could strengthen your eviction prevention program. Next slide. All right, so finally, I just want to end with some examples of ways in which other localities are using ARPA dollars for homelessness services. So Portland, Oregon is a good example here. They're creating what's called safe rest villages to provide places for rest, access to food, sanitation, and wraparound services, as well as access to resources about supportive housing. Next slide. And other places around the country are providing a range of services, from homelessness prevention efforts, including rapid rehousing and behavioral services, places of respite like Portland's investment, but also using funds for development of housing to meet the needs of populations experiencing homelessness. So for example, Louisville, Kentucky is using the second tranche of ARPA funds, so has already kind of earmarked the second tranche to invest in many units of permanent supportive housing, which is housing offered to formerly homeless individuals and families with a suite of wraparound services, which I'm sure many of you know. And finally, I would just end by saying, if you haven't seen it, I would recommend taking a look at the 5-year study of the Denver Supportive Housing Social Impact Bond Initiative, or Denver SIB. There, they provided supportive housing through a housing first approach, aiming really quickly to get people into housing without prerequisites such as negative drug tests or lack of a criminal record. And Urban has been leading the evaluation. It's been a very rigorous evaluation and found more time in housing amongst the group receiving the treatment and reductions in arrests and jail time. So I think that study also provides a really good opportunity for a model. All right, I will end by just saying, here are some of the resources that I think are really helpful in this space if you want more examples or want to try to find more details about specific examples. So you can find the Brookings Tracker, the National Association for Counties, the National Low Income Housing Coalition has a lot of good fact sheets on housing investments that have been made with ARPA. Thank you so much. I'll turn it over to Tina.
Thanks so much. And I see a question in the chat about cash assistance. I can touch on that when I get to that in my slides. So remind me if I forget. And I'm going to try very hard to speak slowly. So please raise a hand or something if I'm speaking too quickly. So like Kate mentioned, while immediate resources are absolutely needed for renters and low-income homeowners in the wake of COVID-19, we also need to institute longer-term, more structural solutions to the housing affordability crisis, which in most of the US predated the COVID-19 pandemic. The pandemic exacerbated this crisis, but it is long-term in nature and we need to institute long-term solutions to it. Next slide. So one such method to addressing long-term housing affordability challenges is inclusionary zoning. I know most jurisdictions within Boulder County already have some form of IZ, short for inclusionary zoning, which requires or offers incentives to developers to set aside a share of units in new developments to be rented or sold at below market rates. And some IZ laws, like the one in Boulder, also allow developers to pay a fee in lieu of developing affordable units or to build the units in a separate location from the main development. So IZ laws, while I know many jurisdictions already have them, you may want to consider revising them or adapting them in the wake of COVID-19. And I'm also speaking about them here just to note their limitations and how they can provide housing for a certain segment of the market, but they really need to be paired with other investments and programs in order to address the full spectrum of housing needs. Next slide. So while there are limitations, IZ has many potential benefits as well. Inclusionary zoning policies can help to develop new affordable housing in high opportunity neighborhoods when it is required for developers to develop on site. Because private market developers are likely going to be selecting high opportunity neighborhoods where the land is valuable, requiring affordable housing on those properties ensures that high opportunities that the rental units have or condos are in high opportunity neighborhoods. It can also help to preserve affordable housing in neighborhoods on the brink of gentrification. IZ can help increase housing stability, increase access to opportunity for households with low incomes and communities of color, like I mentioned, and improve outcomes for youth. There's a wealth of evidence showing that having safe, stable housing in high opportunity neighborhoods has benefits for youth, not only immediately, but in the long run. And finally, programs like IZ and the other ones I'm going to speak about today can help improve the economy overall through increased job retention. We know through a lot of our work that employers in high cost areas are having a hard time finding and retaining employees, particularly low wage workers, if the housing around them is not affordable enough for them to be able to live close enough to the jobs. So these policies help not only individuals, but the economy as a whole. Next slide. However, as I mentioned, IZ has some limitations. It's really mostly a tool best suited to providing units that are affordable to moderate income households, not necessarily low income. So therefore, it really needs to be paired with other investments and other reforms. Next slide. So one example of another policy or program that many jurisdictions are implementing or reforming is rent control. Now, I know that rent control is not currently allowed in the state of Colorado, but I wanted to mention this just in case the state ever does consider revising that, and or if there are types of things that are like rent control that are allowable under your state laws. Many jurisdictions have found alternatives, such as rather than requiring rent control, offering incentivized rent control through tax breaks to landlords who promise to keep rents at below a certain level. But just for background, and so that we can talk about the pros and cons of rent control as well, rent control is a loose term used to cover a spectrum of rent regulations that can vary from hard caps on maximum rents, which were the kind of olden days traditional rent control, to limits on the amount that rents can increase over time. That's often referred to as rent stabilization and is a popular current tool. Next slide. So is rent control effective? Really, the jury is still out on that, although rent control has been shown to increase stability and affordability for the tenants who are lucky enough to be in those controlled units. Some studies have found that those benefits can be offset by greater costs in the rest of the market because some landlords choose to convert to condos rather than renting their units when rent control comes into effect. And critics also question whether the benefits of rent control to truly reach renters with low incomes and renters of color who face the greatest affordability challenges, since rent control is usually not means tested, meaning that anyone can benefit from rent control. You don't have to be below a certain income level. Next slide. So if you all do ever consider designing a rent control regulation and implementing it through reforms at the state or through ways that you can legally design something similar to rent control, it's really important to design those in a way that balances out these pros and cons, and to ensure that it's enforced and implemented in a way that makes sense. There are a lot of details on this I could go into later, but I think at the moment it's not as pertinent for Boulder County. Next slide. I think what is more important when we think about IZ and what it should be paired with is thinking about land use reforms more broadly that can allow for increased density or make development easier and therefore increase the overall supply of housing. We know that a long history of racist policymaking and planning has led to exclusionary zoning throughout much of our nation and has led to segregation of neighborhoods. So we really need to start reforming our land use laws to remove some of those exclusionary zoning practices and allow for increased development. We had a great quote. Some examples of these types of reforms that I'm talking about are allowing for increased height of buildings, reducing setback requirements or how far buildings have to be from the property line, removing parking requirements. That's a big one. Parking can be very costly to developers and often is not needed if the development is paired with increased investments in public transit. Accessory dwelling units are a popular tool being used more frequently to allow for gentle density. This can be a popular tool that is often more, more approved by citizens than drastic increases in density, because you can allow for increased units without drastically changing the nature of neighborhoods. Some places have completely banned single family zoning, meaning that anyone can build duplexes or sometimes triplexes on what would have been previously only allowed to be single family. And then just overall, anything that can be done to simplify the development process can really help with increasing housing supply. There was a great quote we heard from a contractor. I'm going to read it here just because it's so powerful. He said that, I'm going to say that 40 years ago, when I first started being a building contractor, I could walk into the county building with a plan that was basically 3 pages. I would walk out with a permit and it would cost me about $200 in an hour, 1 hour. Now it would take you probably at least 4 to 6 months to get a permit and it would cost you $30,000. Not to mention that 4 to 6 months of lost income through rent. Next slide. Now, again, while all of these policies and initiatives can have benefits, they can also have downsides or limitations. And so what does the research say about the benefits of general upzonings and reforms I was talking about? Well, generally, I'm gonna, since I think I'm behind, paraphrase this a bit, but generally research has found that sometimes upzonings can actually increase nearby housing costs in the short run, because when an area is opened up to additional development, the development that comes in may be so new and nice that it creates amenity effects on nearby properties. So in the long run, that increase in supply is eventually going to filter down and bring down housing costs overall. But in the short run, there can be some negative impacts on nearby housing prices. So next slide. So really, all of these types of investments and programs and policies need to be paired with immediate direct investments in affordable housing. Using things like housing trust funds, which you can get money from inclusionary zoning into those trust funds that you can then use to develop affordable housing directly, paired with things like the low income housing tax credit, or sometimes cities and counties can provide gap financing directly for affordable housing projects. All of these things can be used to directly, immediately create housing that is affordable in high opportunity neighborhoods, to help fill the gaps and limitations in some of these other policies and programs. You can also create or invest in community land trusts. I know there are already some community land trusts in Boulder County. These can be a great way to create affordable home ownership options for households with lower incomes. And I have to note this picture on the right here is a affordable housing development in Alexandria, where I live. I'm on the board of the affordable housing developer who built this. The first floor is a homeless shelter, and above it is all permanently affordable housing for low income families. And it's beautiful. So affordable housing doesn't have to be something that we're afraid of. It can be a great asset to our community. Next slide. Finally, I just want to mention that as I heard others talking about direct transfers, guaranteed income, while not a housing policy per se, is another great way to promote a long-term inclusive and equitable recovery from COVID-19. Guaranteed income, which again has targeted at residents with low incomes or low wealth, it can decrease monetary poverty and improve outcomes for the individual recipients. And it can help the economy overall, because contrary to previously held beliefs about, well, if we give people cash, they'll work less. Recent research actually shows the opposite, that people work more, are more likely to work full time and get better jobs after a guaranteed income pilot, after they've received cash. So really this can be beneficial to the economy overall and to individuals. Now, I saw someone asked about how do you ensure that people don't get kicked off of other benefits when you get cash through a guaranteed income pilot or a guaranteed income program. That's very complicated, and I can provide a lot of resources on that. But generally, there are ways to either get waivers for people from having that income count towards their other benefits. And there are also tools that the Federal Reserve has created that can allow you to calculate benefits cliffs and then ensure that you can monitor people as they are reaching those benefits cliffs, or the point at which they might lose other benefits, to ensure that the cash is not harming them. You can also get state level policy passed to ensure that guaranteed income does not affect other benefits. Okay, next slide. I think that's it. So just as one final closing argument and a plea for, what you all are working towards anyway, is that really ensuring that we invest in equity and inclusion in this moment is so important. And not just for individuals, like individuals below incomes or other people who have been historically excluded from opportunity, but for our economy as a whole. A recent new paper from NBER finds significant aggregate economic losses associated with persistent disparities, losses measured in the trillions of dollars and several tenths of a percentage point in GDP growth. So this really affects our economy as a whole. And in Chicago, for instance, it's been found that segregation has cost $8 billion in GDP. And we have many more examples of how this really harms the inequity, and segregation harms the economy overall. So addressing this is really imperative in this moment. I think I will stop there. I didn't get a chance to see all the questions. I guess we'll probably come back to those. Is that right, Madeline? Pass this back over to you.
Yeah, thanks so much, Tina. There's a couple, maybe just really quickly, and we have 10 minutes now, happy to field whatever we can, and can send other resources as needed. But Tina, there was a question in the chat about ability of ARPA funds to be used for changing zoning laws. Wondering if you could just speak to that a little bit. I don't know if that's a sort of changing or just a supplemental programs towards zoning. But
yeah, good question. I should have mentioned that I wasn't limiting this just to the use of federal recovery dollars and trying to think about how those federal recovery dollar investments can be paired with policy changes at the local level. So while I don't know that you'd necessarily need federal dollars to do zoning reform, you can link these things together through, for instance, many jurisdictions are using ARPA dollars to invest in their housing trust fund, which they can then use to develop affordable housing more directly, or they can use to help supplement their inclusionary zoning programs. So, but really you don't necessarily need money to do zoning reforms. You just need will and, you know, a community engaged process to get to that point. So I don't know of any cities that are necessarily using recovery dollars for that purpose. But really just bringing these up as policies that need to be enacted to ensure that these short-term investments have long-term change. Good question. If you give money to a housing trust fund, does it have to be spent by 2026? I do not believe so. I think it needs to be put into the housing trust fund by 2026, but I can check on that.
Let's open it up to questions. I know we've had a couple, but maybe folks want to raise their hands or just jump in. It's an enormous amount of information. You guys did a great job. Any questions on the non-housing, on mental health, social resilience?
Amy, there are
economic?
a couple hands up.
Oh, okay.
Kurt and Kathy.
Kurt, go ahead.
Hi, I'll just mention that the Regional Housing Partnership has a document that lists all the different zoning and other land use policies that have been put in place in each community. And then there's also a list in there of things that could be done locally. So it's probably a good resource to refer to as we're talking about both policies that have been implemented as well as those that could be in various communities. And we can share that.
Should I go? Yeah, okay.
Kathy, you're up next.
Yeah, hi. This is really a question about the term social resiliency. I'm a mental health advocate with lived experience, a grassroots person, part of a network of grassroots individuals. And I'm just wondering, I just need to understand more what that term means in terms of mental health and the several great ideas that are kind of underway already in Boulder County to increase the co-responders and the hub navigation and so forth. What is social resilience? It seems like a term that people know and that I don't.
I'm happy to jump in. Is that okay? So, and I can send you some readings on this and I can send it to everybody. So social resilience is essentially the practice of knowing your neighbors, of investing in the physical and social things that brings communities together, because studies have shown over time that those who know their neighbors fare a lot better during times of crisis. So there's a great book called Palaces for the People that came out last year that Eric Kleinenberg wrote, and which also includes a rebuild in that book. And we might even be able to get him to do a talk with you.
And to add on, where there's a lot of overlap with mental health interventions is just that social isolation that we saw in the responses from community members, whether it was because they couldn't access technology or they didn't know how to use technology due to cognitive differences, ability, age, lack of broadband. A lot of things that ended up worsening or magnifying mental health, pre-existing mental health concerns, also ended up overlapping with the interventions you would have to build up that social resilience on a broader scale for all the community members to ensure a better outcomes in the future.
Yeah, I'm really open to hearing and talking about those ideas. I'm also though wondering, earlier we saw slides about the severe mental health crisis in Colorado and the kids that are ending up in the emergency room. So I'm sort of looking, as we're talking about some of the other issues, it sounds like the Urban Institute had some really great ideas for like big picture direct ways to impact the people most affected. And so just kind of like trying to piece this together. And while they're here, I guess I'd like to hear how the actual lived mental health crisis is factored into this discussion of social resilience.
Yeah, it absolutely is. And we can follow up in your working group. Anne-Marie?
So I'm going to try and word a difficult question with as much sensitivity as I can. In our area, the African-American population is, last time I looked, about 1.14%. And if part of our goal is diversity and inclusion as we do whatever we're going to do, I don't know how many of those 1.14% of the African-American population are in need of the things we're talking about, like mental health services or housing. But even if we assume they all are, it's still not a very big population. And if we're trying to increase the diversity of our services, we may have people, for example, who can't afford to live here right now, who are living elsewhere and commuting in because our housing costs are so high. Has anybody that you guys have looked at faced a similar situation where there are obstacles to diversity, and whether they've extended beyond the reach of their own community to try? I as an affordable housing advocate, I know that if we create more diverse housing, we will have a more diverse population. And so I'm all over that. But in the short term, what can we do to make sure that our services include that population when there are so few of those folks in our community? And has anybody figured out a way to do that? Because I think our reach is actually bigger than that in terms of the folks who either work here or go to school here or have, some connection to our community, but they're not living here right now. So I was just curious if you have seen anybody else who has addressed that.
I can start on this, and Tina, Kate, curious what you all would say too. I want to sort of reemphasize that I think part of the reason that we focus so much on racial equity is because we know that we have a history of racist policies, especially in housing. And it's important to make sure that we are designing in a way that acknowledges those histories. That's not to say that every place is going to have the same issues of racial equity or the same populations. So I work in Riverside County right now, where they're really focusing on young women of color who are parents. Like, that is their target population, because in their data, those are the people who have been most impacted in the last 6 months. So I think it's sort of the both and. It's, let's make sure we're understanding the real racial implications of our policies in the past, but also acknowledging that every place is going to have different demographic challenges, which is why it's so important to do that community engagement sort of along the way, as you all are doing. But I don't know if on the housing sort of specific side of things, if Tina or Kate, you have other thoughts as well.
I was just going to point to some examples. We did some case studies when we studied inclusive recovery prior to COVID. We fortuitously were, looking at past examples of places that had inclusively recovered from distress to try to learn from them. And one place that popped up, I think might be similar to what you're saying, was Lowell, Massachusetts. So they had a large influx of Cambodian refugees in, I think it was the 90s. And similar issues. They didn't really have a service system set up to provide services to that community, but they really did concerted efforts to do deep and meaningful community engagement with that community. And then they what we say, like, literally celebrated that community. They ended up creating the Southeast Asian Water Festival that now brings like tens of thousands of tourists a year to celebrate the culture. They have, community groups that are led by the Southeast Asian community. And so we can send that report to you, but I'm just trying to think of examples of what you're saying of trying to figure out how to align resources with a small population within your community. I mean, it really just starts with trust building and community outreach. And, we have a whole bunch of practices, which you probably are using a lot of them, but around how to best lead community engagement in a way that can engage with smaller populations or your most historically excluded populations. But I like what you were saying about, I think the important part here is that in order to solve that problem of being exclusive, right? That's the word, is we need to invest in affordable housing. That's the only way we're going to be able to diversify our communities, because again, this all links back to our history of structural racism in our country. I would urge you all to read the book, The Color of Law. It will open your eyes to the history of how we got to where we are, of our Black-white wealth gap and other wealth gaps by race and ethnicity. And really, this needs to be addressed through zoning reform and housing policy, amongst many other things. Cash transfers are another big way of addressing these wealth gaps that led us to where we are.
There's nothing I can add to those two amazing responses. I'll just say that in the comments, there was a comment about the Native American population, and I think that's a really important component of this too.
I just want to thank you so much for all the time you took and all the research that you did to ensure that this is reflective of what these working groups are working on. We really, really appreciate it. And if we get any other follow-up questions, I'll be sure to let you know. But thank you so much. We very much appreciate your time.
Thank you all. Thanks for having us.
Take care. So now we're going to split up into the working groups. We have a very short 5-minute break. Johanna, can you remind us which is the group that's staying here? Housing affordability is staying here. Thank you.
Housing has it easy. And then I was gonna say that, oh yep, Sophia posted the links in the chat, but also you should have received a calendar invite with those links if you're in the economic challenges or mental health and social resilience groups. Amy will be in the mental health and social resilience group, and then economic challenges, you'll meet one of our colleagues, Sam, who's going to be helping with the tech and has that meeting open already for economic challenges.
And just a reminder that we're going to meet back here at 3:45 for those who can stay. Certainly the co-chairs, and if anybody else can stay for the last discussion, please do. If you can't, then we've made it optional because we know this is a super long day and we really appreciate your time. So we're going to now turn it over to the co-chairs who are in charge of the breakout group. So we'll see you at the other side.
Did you want people to take a break real quick, or?
Just in 5 minutes. We're going to spend five minutes to move over to the next.
Okay, sounds good.
Okay.
And if anyone is unsure where they're supposed to be, just send me a message or you can ask here.